we. Climate change is causing natural disasters and destroying livelihoods. Universal health coverage for all is unattained and remains a key objective. Most recently, the COVID-19 pandemic has highlighted the importance of a strong World Health Organization as the leading and coordinating authority within our global health architecture. Among the lessons of the pandemic are these. First, a strong WHO needs sufficient and predictable funding. That is why Germany has campaigned for the increase of assessed contributions to represent 50% of the WHO's core budget. And second, prevention, preparedness, and response are key. So let us join forces and reach an ambitious pandemic agreement soon, in a spirit of equity, solidarity, and international cooperation. We have proven in the past what we are able to accomplish if we work together. Together, we will also contain the health threats of the future. We are WHO. I wish you a successful World Health Assembly. Happy birthday to us, the entire WHO family.
Distinguished ladies and gentlemen, it is my pleasure to join the international community in celebrating this year's World Health Day, which coincides with the 75th anniversary of the World Health Organization, WHO, under the theme, Health for All. Health for all, which is a basic human right for everyone, envisions that all people should have good health for a fulfilling life, prosperity, and sustainability. Over the 75 years of existence of the World Health Organization, we can reflect on our collective successful results in managing public health effectively. As a result of our resolve to prevent and control diseases, we have won the battle against smallpox, polio, Ebola, as well as the recent deadly COVID-19 pandemic, among others. In 1948, Liberia was among the founding nations to establish the World Health Organization because of our shared commitment to improving people's health, regardless of their race, political affiliation, and gender. It is also worthy to note that Liberia was the first African country to sign the WHO Charter on 14 March 1947. Liberia was also among the countries that drafted the 1978 Ama-Ata Declaration, which identified primary health care as key to attaining the goal of health for all by the year 2000. Today, this dream is being steadily realized when we see that countries are now reorienting their health systems towards primary health care in order to achieve universal health coverage and the health-related sustainable development goals, the SDGs. The WHO footprints in Liberia have existed for over 70 years, providing valuable policy, strategic, technical, and operational support to Liberia's public health delivery system. This 75th anniversary therefore gives us the opportunity to reflect on the major achievements in public health that have contributed to improve the quality of life of all Liberians. My government will remain committed to the advancement of quality public health care to all Liberians and will continue to maintain a strong partnership with the WHO in order to attain this goal. Distinguished ladies and gentlemen, happy 75th anniversary to the World Health Organization. I wish you all good health. I thank you for your attention.
As we are still grappling with the aftermath of a pandemic that took a large toll on our lives, our livelihoods, and our economies, we have even more reasons to celebrate the World Health Organization's 75th anniversary. COVID-19 has indeed demonstrated that global challenges can only be tackled through global action. To address the major health crises of our times, including climate change and humanitarian disasters, we need a concerned multilateral approach and common efforts. I applaud WHO for its relentless commitment to health for all, regardless of where and how people live, and assure you that Luxembourg continues to be a reliable partner in this quest. I wish you a happy birthday and successful 76th World Health Assembly.
that no one is safe until everyone is safe. It is therefore imperative to ensure full implementation of the IHR in all special focus on developing core capacities to detect and manage public health emergencies in those countries that face the greatest risks and challenges. We believe that the regional offices play an important role in providing such technical support and capacity building. We are pleased to see that the report refers to the importance of communication, coordination, and a One Health approach, both within and among state parties, as essential in ensuring successful implementation of the IHR. Denmark fully supports this sentiment. We also welcome the Secretariat's efforts in ensuring close interagency collaboration in the context of public health emergencies. We encourage the Secretariat to continue its systematic approach to multi-sectoral engagement, as well as monitoring related to the implementation of and compliance with the IHR. Denmark will continue to support and contribute to the revised State Party Self-Assessment Annual Reporting Tool. We believe that the assessment should be used actively by both state parties and the WHO to identify and address particular gaps and challenges in our health emergency preparedness and response capacities. We are therefore pleased to note the high response rate in 2021, and we hope to see this trend continue in the future. Finally, Denmark will continue to support the important process on strengthening the IHR through targeted amendments. In this context, we find it highly important to maintain the technical nature of the IHR and to ensure that the parallel process on a pandemic agreement does not result in redundant parallel provisions and structures. Also, the current negotiation processes should not halt the Secretariat's efforts in strengthening the collective implementation of the IHR. We urge the Secretariat to maintain its strong focus on building capacity for the full implementation of existing provisions in the IHR over the next 2 years. Thank you.
Thank you, Delegate of Denmark. Now the floor for Democratic Republic of Korea, followed by Delegate of Ethiopia.
Thank you, Madam Chair. The DPRK delegation would like to make some remarks under agenda item 14.2, 15.1 and 2. First of all, my delegation would like to express gratitude to WHO Secretariat for its active efforts to strengthen global architecture for health emergency preparedness, response, and resilience, and especially for the coordination of global response to COVID-19. In this regard, we express our full support to the CR regional statement delivered by the distinguished delegate of Bangladesh. In the past 3 years since COVID-19 public health emergency, more than 766 million infected cases and 6.9 million deaths have been recorded globally, and many people are still suffering from long COVID. This undeniable reality requires every member state to establish concrete preparedness strategy, not only for COVID-19, but also for future pandemics, while building up and strengthening core capacities of IHR. COVID-19 is a challenge, but not also an opportunity for WHO and all member states. As per the experiences and lessons learned from this pandemic, we recognize the necessity of amending IHR. IHR, while supporting the development of new pandemic treaty as well. In this regard, we assert to pay due attention to avoiding duplications between IHR and pandemic treaty, ensuring equity and respecting sovereignty of member states, and never allowing attempt to politicize the organization's activities. Besides, WHO, as an international organization dedicated to the global public health, should drive strengthening preparedness and response to public health emergencies in all countries and regions and across the world, thereby play the leading role in overcoming current and future health emergencies. Meanwhile, it is also important to establish a comprehensive and resilient public health and anti-epidemic system that is ready to respond to public health emergencies and disease outbreaks in member states. Madam Chair, preventive medicine is the basic principle of public health policy in DPRK. The public health law of our republic regulates that the government regards it as its important duty to take advanced measures to prevent people from diseases. In April last year, a national public health crisis emerged due to inflow of the stealth Omicron virus into the country. However, we have achieved a very great success in stabilizing and restoring the anti-epidemic situation over 100 days since COVID-19 intruded into the territory and 91 days since we switched the national prevention work to the maximum emergency epidemic prevention system. Thanks to the household doctor system, emergency medical system service, telemedicine system, and other people-oriented and advanced medical services, the identification of fever cases, screening and examination of the entire population were undertaken every day, and quarantine and treatment were conducted in an appropriate way. Pushing forward, building up the national crisis response capacity to reach the global standard is the firm will of the government of our republic. The DPRK will further strengthen national crisis response capacity to public health emergencies so as to defend the safety and security of the state and the people in close collaboration with WHO and other international organizations. In conclusion, the DPRK supports and sponsors the draft resolution proposed by the Russian Federation under agenda item 15.2, WHO's work in health emergencies regarding implementation of resolution WHA 75.11. Thank you.
Thank you. And now the floor for delegate of Ethiopia, followed by delegate of USA.
Thank you, Madam. Ethiopia aligns with the statement delivered by Tanzania on behalf of the 47-member state of African region on public health emergency and will address agenda item 15.2 in this statement. As reflected in the report, the African region and especially the Horn of Africa have been affected with additional burden on the regional economy, health system, and population health at large. Ethiopia being confronted with diverse health emergencies such as epidemics, drought, and floods in certain parts of the country. The government of Ethiopia, in collaboration with all stakeholders, is actively working to address these challenges. Currently, the country is providing cholera vaccination, conducting nationwide integrated supplementary immunization activities, and treating malnutrition and establishing national and subnational coordination mechanism integrating to public health care, primary health care. Furthermore, the government of Ethiopia is continually striving to ensure essential health service in all conflict-affected areas, including the northern part of Ethiopia, namely Afar, Amhara, and Tigray, as well as certain areas in the Oromia and Benishangul Gumuz regions. Chair, as you may be aware, the situation in the northern part of Ethiopia, including Tigray, has significantly improved since last year, November, Pretoria Peace Agreement, which was followed by the establishment of a regional interim government. The government of Ethiopia, in collaboration with the stakeholders, the international stakeholders, is making every effort to restore essential service, including health care, the community in Tigray. Presently, essential medicine have been restocked in regional warehouses and distributed to the health facilities, which helped the health facility in providing essential health care service to the community in need. However, considering the profound impact on the health system and the community, a strong and comprehensive response is required to rebuild the health system in a better way. The situation deems concerted effort, increasing coordination and restoration mobilization more than ever, and will call upon all stakeholders to collaborate with the government of Ethiopia for the continued response to health and humanitarian emergencies and for restoration and rehabilitation effort. Regarding the agenda item of 14.2 on the implementation of IHR, we wish to thank the Secretariat for the report and the Working Group IHR Bureau for the ongoing discussion regarding the amendment. Ethiopia has established a comprehensive public health management system at the national and subnational level to enhance preparedness and response, and stands at the Health Security Index of 0.63 and the Resilient Index of 0.49. Based on SPAR 2020 self-assessment, the country average capacity is 74%. Despite our progress, we still face challenges in meeting the core capability, including the timely detection, surveillance, logistic, and point of entry capacities. We call up on all key actors, particularly the IHR Secretariat, to maintain and intensify their effort in implementation. We wish to see the operationalization of equity in the amendment of the IHR that includes support for implementation of core capability to better protect the world from public health threats collectively. I thank you.
Thank you, Delegate of Ethiopia. Now the floor to Delegate of USA, followed by Delegate of Oman.
Thank you, Chair. Russia's unprovoked war against Ukraine has created a humanitarian crisis in Ukraine with far-reaching health, social, economic, and other impacts in the region and globally. The brutal attacks by Russia's forces have displaced millions, destroyed critical health facilities, deprived millions of safe and reliable access to essential health services, and disrupted essential medical supply chains. The WHO last reported on May 4th, 2023, that Russia has attacked healthcare facilities 959 times and caused the death of 8,709 civilians. This is unacceptable and must stop. The displacement of millions of Ukrainians across international borders is also straining health systems in neighboring countries and across the region. The figures are staggering: over 8.2 million, with over 12.5 million return border crossings and more than 5.4 million people internally displaced. We thank WHO and the other UN humanitarian agencies and partners that are working tirelessly to provide millions of Ukrainians, including those forcibly displaced, with life-saving health services and related products, and we continue to encourage WHO's support of the health cluster to coordinate and prioritize humanitarian health action. As Russia's brutality continues, the impact on global health deserves the highest level of attention. We welcome and note WHO's updated report on the implementation of last year's resolution on the health emergency in Ukraine due to Russia's aggression. We express our support for the Ukraine decision associated with this report and urge WHO member states to keep the focus on the dire global impact of the health and humanitarian crisis in Ukraine by also expressing your support. We thank WHO and the other UN humanitarian agencies and partners. The United States also thanks the Director General for the report on WHO's response to health emergencies in 2022, and we welcome the update on the Universal Health and Preparedness Review pilots. The United States continues to be fully committed to the negotiation of a new pandemic accord and amendments to international health regulations to build our collective capacities to prevent and respond to future pandemics, and to do so in a way that expands equity for all. This year's sobering report of the Independent Oversight and Advisory Committee for the WHO Health Emergencies Program should serve as an urgent call to both the Secretariat and member states to renew our focus on the fundamentals of the WHE. We call on the Secretariat to take steps to implement the recommendations of the IOAC, in particular, to clarify roles and responsibilities across the three levels in line with WHO Decision 69-9, develop and resource a staffing strategy for the WHE workforce, ensure efforts to improve the resource base for WHO extend to WHE, and address organization-wide issues such as gender, sexual misconduct, and institutional culture that are particularly important to WHO's emergency work. The United States is committed to the IHR amendment process through the Working Group on Amendments to the IHR 2005, and will continue to work with member states to update the IHR to make it fit for purpose and able to address health emergencies at the earliest possible instance. Member states must continue to improve IHR implementation and compliance by implementing core capacities and striving to improve communications, connectivity, and transparency. The United States is committed to moving forward with a package of targeted amendments to the IHR at WHA 77 and ask that all member states dedicate time and effort to that important agreed outcome. Regarding the HEPR proposal, much has already been done to create and evaluate the current global health architecture, such as the International Health Regulations 2005 and its accompanying monitoring and evaluation framework that focuses on core capacities to prevent the spread of disease, and we must deconflict any potential issues that may interfere with current monitoring and evaluation. At the 153rd session of the Executive Board, the United States will propose that the EB task the Subcommittee on Health Emergency Prevention, Preparedness, and Response to carefully consider the HEPR proposals, report to the 154th Executive Board on any area of potential confusion or overlap, and provide a recommendation to the EB on how to address the identified challenges. On the clinical trials item, once the Secretariat releases the initial draft of the guidelines landscape of best practices for clinical trials, we request that an initial consultation be convened soon thereafter for member states to provide feedback before the guidance is finalized. For clinical research in outbreak response settings, we encourage the WHO to consult early and to coordinate with host countries, global experts, and vaccine and therapeutic developers and providers on the development and execution of well-designed clinical trials that respond to the needs of the country experiencing the outbreak. In closing, the United States wishes to extend our sincere gratitude for the work, and in particular to the staff of the WHO for their tireless dedication and service in responding to an ever-growing number of health emergencies. Thank you, Chair.
I thank the delegate of United States of America, and I now give the floor to delegate of Oman, to be followed by delegate of Vanuatu.
شكرا سيدة الرئيسة. عملت سلطنة عمان منذ دخول اللوائح الصحية الدولية 2005 حيز التنفيذ على بناء وتعزيز القدرات الوطنية الأساسية لمتطلبات اللوائح الصحية الدولية وتطوير الإمكانيات والقدرات في نطاق الدخول والمساهمة مع الجهات المعنية في المطارات والموانئ في إعداد خطط الطوارئ للاستجابة للأحداث الصحية الطارئة في معابر الدخول. ويشارك فريق من المختصين في وزارة الصحة بسلطنة عمان في الاجتماعات المجدولة والموضوعة تحت مظلة منظمة الصحة العالمية لأغراض مراجعة ووضع التعديلات المقترحة على اللوائح الصحية الدولية وتعزيز استعداد منظمة الصحة العالمية للطوارئ الصحية والاستجابة لها وتعزيز الهيكل العالمي للتأهب والاستجابة للطوارئ الصحية والقدرة على الصمود أمامها والتقييم العالمي للمخاطر من منظور الصحة الواحدة. داخليا اهتمت سلطنة عمان كباقي الدول بإدارة الأزمات والطوارئ وذلك بالتخطيط الاستراتيجي لها وإعداد خطط للتعامل معها والاستجابة لآثارها وإدامة التواصل والتنسيق مع الجهات المعنية وضمان سير عمل جميع المنشآت الصحية بجميع محافظات سلطنة عمان من خلال مركز متخصص لإدارة الحالات الطارئة. عالميا شاركت وزارة الصحة في اجتماعات هيئة التفاوض الحكومية الدولية، وقد أرسلت المقترحات والتعديلات والإضافات المقترحة بالتشاور مع جميع القطاعات ذات العلاقة في سلطنة عمان على المسودة الصفرية إلى هيئة التفاوض الحكومية الدولية. وفي إطار التسريع بالعمل لتنفيذ نهج الصحة الواحدة، فقد استضافت سلطنة عمان في الفترة من 8 إلى 11 مايو 2023 اجتماعا إقليميا رباعي الأطراف لتسريع تنفيذ برنامج الصحة الواحدة في إقليم شرق المتوسط بحضور ممثلين عن القطاعات المختلفة من 22 دولة في الإقليم. السلطنة على توافق مع ما جاء في بيان إقليم منظمة الصحة العالمية لشرق المتوسط فيما يتعلق بالجاهزية والاستعداد للطوارئ الصحية، ومستمرة في دعم الجهود على المستوى المحلي والإقليمي والدولي لتعزيز منظومة التأهب والاستعداد للطوارئ الصحية والاستفادة من دروس الماضي والخبرات التراكمية والبحث والابتكار في بناء هيكل وقدرات تصمد أمام المتغيرات والتحديات المستقبلية. السيدة الرئيسة، الزملاء الأعزاء، على مدى السنوات القليلة الماضية شارك العديد منا في أكثر من مناسبة في المناقشات والمشاورات المكثفة التي كانت تجري حول المبادرة العالمية للصحة من أجل السلام. ويسعدنا في سلطنة عمان أن نرى أن قرار جمعية الصحة العالمية 24/75 قد تم تنفيذه، وأن خارطة الطريق التي نص عليها القرار قد أنجزت وهي معروضة في هذا الاجتماع. ويسعدنا أكثر ما شاهدناه خلال السنوات الخمس الماضية من جهد منظم وآلية عمل راقية عبر سلسلة متواصلة من المناقشات والمشاورات المكثفة والمداولات التي أدارتها أمانة المنظمة بمهنية عالية واقتدار، مكنتنا من الوصول إلى هذا المنتج الاستراتيجي الهام. ونثمن عاليا هذه العملية التي أسهمت في توسيع معارفنا ومداركنا للقيمة الكبيرة لمنظمة الصحة العالمية ومقدرتها على القيام بهذا الدور الذي حرصت فيه على إشراك الجميع في مختلف المراحل منذ ولادة فكرة المبادرة ونموها التدريجي وصياغتها وحتى ترجمتها إلى أفعال ملموسة. لقد أصبحت المبادرة العالمية للصحة من أجل السلام حقيقة واقعة اليوم، تبلورت ونضجت من خلال التشجيع والمشاركة والدعم الذي قدمته الدول الأعضاء والشركاء، وكان للجميع الفضل في دفعها من مرحلتها الجنينية إلى مرحلة النهج الاستراتيجي القابل للتنفيذ، أي خارطة الطريق التي نعتبرها استراتيجيتنا القادمة للمضي قدما لتنفيذ المبادرة. السيدة الرئيسة، الزملاء الأعزاء، نعتقد اليوم أن خارطة الطريق بأهدافها الاستراتيجية ونهجها ومبادئها ومسارات عملها واضحة بما فيه الكفاية، ونرى أنها في الظروف الحالية تفي بالغرض المطلوب، كما أن أولويات السياسات والاستراتيجيات التي حددتها أمانة منظمة الصحة العالمية لنفسها في إطار كل مسار عمل للخمس السنوات القادمة مناسبة أيضا. في بيان سلطنة عمان في المجلس التنفيذي الأخير أكدنا على الحرص على الوفاء بجوهر المبادرة والعمل على تحقيق مكاسب السلام الأساسية مثل المساواة والشمولية والمشاركة والملكية والقيادة المحلية ومراعاة خصوصية كل بلد في سياقها العام، لقناعتنا بأن ذلك سيسمح بتعزيز وتمكين المجتمعات الضعيفة محليا، وسيسهم بالتالي في تقوية التضامن الدولي والسلام والاستقرار والأمن. ختاما، نود أن نشدد على أننا يجب ألا نفوت الفرصة المتاحة أمامنا، لأن تحقيق الصحة والسلام يحتاجان جهودا مكثفة ومتواصلة، وهما مرتبطان، فدعونا نجعل الصحة أحد الجسور المؤدية إلى السلام. شكرا وتمنياتنا لهذا الاجتماع بالتوفيق.
I thank the delegate of Oman. Now the floor to delegate of Funoto and then followed by delegate of Biro.
Thank you, Madam Chair. Greetings to all delegates participating in this important session. First and foremost, I want to share the greatest gratitude to WHO Secretariat on the report of the Independence Overview and Advisory Committee for the WHO Health Emergencies Program. Madam Chair, the Republic of Vanuatu is a small island state in the Pacific that remains vulnerable to disease outbreaks, environmental and food-related emergencies, and the health consequences of disasters such as coastal erosion and intrusion, floods, landslides, droughts, volcanic ashfall, earthquakes, and tsunamis. In early March this year, 2023, Vanuatu again had 2 cyclones that made landfall within 3 days apart that led to the government declaring a 6-month state of emergency, which is current. More than 80% of the population has been affected and is slowly recovering from the impact of these cyclones. The COVID-19 pandemic has exposed the weaknesses of our health systems that has led to significant disruptions in the health services provided. Setbacks in our health gains and efforts to achieving our program targets. And the malaria increase last year in Vanuatu 2022 is a classic example that has pushed our efforts back to achieving malaria elimination to 2029. The challenges of COVID-19, severe tropical cyclones, and concurrent outbreaks has highlighted the critical importance of continuing emergency preparedness and essential health services through strengthening national capacity for coordination and response. Disruptions to travel, trade, and tourism brought to our shore by COVID-19 further emphasize the need for national resilience. Our population also faces an uncertain future due to climate change and the ever-present threat of natural disasters. There is ongoing need to strengthen and sustain national capacity in preparedness, prevention, response, and recovery using all-asset approach. A lot of effort has been put into strengthening our civilian system. In Vanuatu, where the human resource for health is particularly limited, it is often the same health staff managing public health emergencies and responding to the health consequences of disasters, thus leading to burnouts, mental health issues, and psychosocial support issues. In this context, we are examining how best to integrate and streamline efforts to ensure sustainability and resilience through the development of the National Action Plan for Health Security. Our 2022 self-assessing score for IHR core capacity stayed at 52%, which we think is well reflecting where we stand in terms of needs. Currently, the Ministry of Health is working hard towards establishing the One Health Committee, where all related line ministries will be part of the committee. WHO has been a key partner to the government of Vanuatu in planning, preparing, responding, resource mobilization, and capacity building. We thank the WHO Secretariat and other development partners and supporting member states and continue to urge the support to protect the population of Vanuatu from the scourge of diseases such as COVID-19 and the natural disasters that are inevitable part of life in the Pacific region. Thank you, Madam Chair.
Thank you. Now, Delegate of Bureau, followed by Delegate of India.
Muchas gracias, señora Presidenta. Mi delegación agradece a la Secretaría por la elaboración de los informes vinculados a los ítems 14.1, 14.2, 15.1, 15.2 y 15.3. Deseamos, en primer lugar, referirnos al informe sobre la aplicación del Reglamento Sanitario Internacional, o RSI. Con la experiencia de la pandemia de la COVID-19, sabemos que es importante fortalecer el RSI a través de enmiendas concretas, las cuales vienen siendo discutidas en el marco de un grupo de trabajo dedicado al tema. No obstante ello, el Perú cree necesario mejorar el cumplimiento por parte de los Estados de las recomendaciones temporales del Director General de la OMS, así como de los mandatos del RCI ya existentes. También creemos necesario optar por un sistema de alertas intermedias ante la sospecha de emergencias de salud pública. Podrá permitir tomar acciones oportunas para una preparación más temprana y una mejor asignación de recursos. Señora Presidente, en cuanto al informe titulado Fortalecimiento de la Arquitectura Mundial para la Preparación, Respuesta y Resiliencia frente a Emergencias Sanitarias, coincidimos que la crisis sanitaria de los últimos 3 años, que enlutó millones de hogares y trajo consigo graves consecuencias socioeconómicas, puso en evidencia que los desafíos mundiales tienen que ser enfrentados por la comunidad internacional de manera solidaria. No obstante ello, consideramos necesario traducir dicho principio en propuestas de medidas concretas. Por eso, el Perú viene promoviendo el principio de la equidad en el marco de las negociaciones del futuro instrumento internacional, para que permita garantizar el acceso universal a las contramedidas médicas, como las vacunas, sin discriminación ni privilegios, y que aborde cuestiones relacionadas como la investigación y el desarrollo, la transferencia de tecnología y la ampliación de la capacidad de fabricación local y regional de contramedidas médicas durante las emergencias. Señora Presidente, el Perú saluda el importante trabajo que viene realizando la OMS para responder a las diferentes emergencias sanitarias en el mundo y los logros alcanzados. Tomamos nota que tanto la COVID-19 como la viruela del mono han dejado de ser consideradas emergencias de salud pública de importancia internacional, al tiempo de recalcar que será importante seguir monitoreando cómo evolucionan dichas enfermedades a fin de estar preparados ante cualquier cambio sustantivo en el futuro. Vemos con preocupación que se mantienen diversas emergencias sanitarias prolongadas en diferentes partes del mundo, afectando a diversos sectores de las respectivas sociedades, en particular a los más vulnerables. Al respecto, saludamos los esfuerzos que ha venido desplegando la OMS a fin de responder de manera oportuna y óptima en las diferentes emergencias, como la de Ucrania. El Perú aprecia la crucial labor de la OMS para responder a la emergencia sanitaria y humanitaria en Ucrania, así como en los países que reciben y hospedan a sus refugiados. Teniendo en cuenta que la situación en Ucrania se encuentra en constante evolución, consideramos necesario que la OMS continúe informando sobre la labor que viene realizando, brindando una actualización antes de la próxima Asamblea Mundial de la Salud, por lo cual el Perú apoyará el proyecto de decisión presentada por Ucrania y un grupo de países sobre este tema. Finalmente, en cuanto a la Iniciativa Global para la Salud por la Paz, el Perú apoya plenamente esta importante iniciativa que busca materializar el vínculo entre la salud, la cohesión social y la paz, centrándose en el papel único que los programas de salud pública pueden desempeñar para convocar a diferentes grupos y fomentar la confianza. Por ello, apoyaremos su adopción. Muchas gracias.
Thank you, Delegate of Bureau. Now, Delegate of India, followed by Delegate of UK.
Thank you, Chair. The reports by the Independent Expert Oversight Advisory Committee have pointed out the chronic financial and staffing limitations faced by the WHE program. The COVID-19 pandemic further highlighted the inadequacy of the WHE program in handling a global pandemic while also responding to other emergencies. We reiterate that WHO, as the global leader, needs to garner all its expertise to make sure that the World Health Emergency Preparedness response runs at the best of its ability and should be adequately funded. Chair, India takes note of the Director General's report on strengthening WHO preparedness for and response to health emergencies, wherein, very rightfully so, the need for strengthening the global architecture for health emergency preparedness, response, and resilience has been highlighted. India also takes note of 10 proposals under 3 crucial pillars of governance, systems, and financing that have been brought out in this report. In consonance with the principles and proposals brought out in the Director General's report, India, under its G20 presidency, has prioritized health emergency agenda with an aim to converge the efforts going on globally to ensure optimal usage of resources. India has also prioritized medical countermeasure platforms and digital health to ensure availability of these tools to every country, especially LMICs and LICs, so that every country can address its health challenges in crisis time and also ensure better health service delivery to its citizens in normal time. Chair, in reference to the issues highlighted in Director General's report, we would like to highlight that there is a need for the convergence in various efforts directed towards health emergencies, prevention, preparedness and response, as well as deliberations being held for amendment to international health regulations, as well as development of the new pandemic accord. This would enable countries to prevent, remain prepared for, and develop resilience to future global public health threats. Chair, we have learned many lessons during the last pandemic, and the world has suffered socially, economically, and many other aspects. As this health emergency is over now, we should not lose our focus on action and move ahead from principles and take tangible actions so we can prepare the world for the next health emergency. Thank you.
Thank you, Delegate of India. Now, Delegate of United Kingdom, followed by Delegate of Jamaica.
Chair, let me start by echoing statements made by others on the unsatisfactory nature of the grouping of these agenda items. We are grateful for the work of the IOAC under the leadership of Walid Ahmar and the committee's detailed report. The need for WHE is indisputable. We endorse the IOAC's view that WHE should be strengthened with a focus on areas including alignment between the organisation's 3 levels, risk oversight and country-level staffing. We also support the important IOAC recommendations on PSEH. Great strides have been made to address weaknesses in this area, but we have to maintain the momentum. The risks of misconduct in crisis contexts are heightened. So we look forward to the updated emergency response framework publication, and we reiterate the need to improve the organisational culture in this area. On the international health regulations, Madam Chair, we strongly support the IHR as an important public health framework for countries to use, to plan and to prioritise investments. We applaud the ongoing support provided by the WHO, in particular the training and the experience exchanges among national focal points. We also acknowledge WHO and Member States' efforts to develop and to roll out version 3 of the joint external evaluation and the review of other tools in the IHR monitoring and evaluation framework. We welcome the fact that support for IHR implementation and capacity building continues in parallel with the work to strengthen the IHR themselves through targeted amendments. Once there is agreement on a strengthened IHR, we'll work with partner countries to flex support to meet new requirements and continue to work with others to build both capacity and capability. Madam Chair, as the health emergency preparedness and response work continues, the UK supports the recommendations of the IOAC that the Standing Committee on Health Emergencies Prevention, Preparedness and Response should play a role in analysing and evaluating broader global health emergency reforms. And we think this role can be successfully fulfilled alongside its more operational portfolio. On clinical trials, Madam Chair, the UK welcomes the continued work of the Secretariat to deliver the activities at WHA 75, and we look forward to consultations later this year. The Executive Board held rich discussions on the resolution, including on the Secretariat's proposal for developing a self-assessment tool for clinical trial ecosystem development. In our view, whilst the Executive Board broadly supported the work of the Secretariat, it also asked for further work on the new self-assessment tool. The joint statement that we delivered at the Executive Board recommended that the Secretariat bring this proposal for consideration by a future session of the WHO governing bodies once progress had been made. We believe that WHA 77 is the appropriate time for the Secretariat to bring forward such a revised proposal. On the Global Health for Peace initiative, we appreciate ongoing efforts and we are happy to continue discussing the roadmap. This is an important initiative that we need to get right. We also note the continued breadth and complexity of emergencies that the WHO is supporting in countries to prevent, prepare for, and respond to. We would welcome more information on lessons learned from responses so as to inform response effectiveness and efficiency. Finally, Madam Chair, the UK reiterates our condemnation in the strongest possible terms of President Putin's brutal invasion of Ukraine, which continues to cripple health systems and cause grave health impacts, not just in Ukraine, but far beyond. And we note the Director General's report on the implementation of WHA 7511 and the harrowing reports contained within, including the over 21,000 civilian casualties, the over 900 attacks on health services, and the over 12 million refugees or internally displaced persons provoked by Russian aggression. The long-lasting impact is greater even than these shocking figures present. So we thank the WHO for its ongoing support to Ukraine, and we thank those countries hosting Ukrainian refugees in the face of that Russian aggression. We are aware, Madam Chair, that, like last year, Russia has passed around pamphlets to our fellow delegates which allege that Ukraine has been attacking its own health system. Madam Chair, this is the theatre of the absurd. This is nothing more, nothing less than another example of gratuitous disinformation promulgated by the Russian state in an attempt to distract and confuse the World Health Assembly. We are confident that the vast majority of our fellow delegates here today won't be fooled by such disinformation or the cynical resolution which Russia has proposed, and will instead support Ukraine's draft decision and remain committed to the crucial work of ensuring that WHO can and will continue to support the health response in Ukraine and beyond. Thank you very much.
Thank you. Now the floor to Delegate of Jamaica, followed by International Council of Nurses.
Thank you, Chair. The experience with the COVID-19 pandemic provides a unique opportunity to develop national action plans for health security that takes into consideration a COVID-19 interaction review. Jamaica conducted a comprehensive interaction review in 2022, and we commend the support of the WHO that allowed for the conduct of this review, and especially thank PAHO for the tremendous support received. Many of the findings can be incorporated into a national plan as projected by the WHO Strategy 2022-2026 for the National Action Plan for Health Security. Jamaica will use the findings to plan for addressing priority areas identified for action within an all-hazards emergency response framework. The preliminary assessment indicates that some of the actions to implement the recommendations need external support. Some are already aligned to PAHO's Health Emergency Strategic Plan lines of action, including emergency workforce, laboratory strengthening, surge capacity development, and enhancement of emergency medical care. Chair, the impact of the COVID-19 pandemic was lessened by the capacities that were achieved on the work done from the implementation of the preceding PAHO 2016-2021 Plan of Action for Disaster Risk Reduction. It is important that we not lose momentum, but continue to strengthen preparedness and response, bearing in mind the strategic lines of action under the DRR 2016-2021. For Jamaica, 3 of the 4 areas of action attained significant improvement. These are strengthened coordination capacity through Health Emergency Operations Center and improvement in the governance system. Progress in safe and smart program for health facilities with support of PAHO for the smart healthcare facilities in the Caribbean project, and enhanced health sector capacity for health emergencies and disaster response through various workforce strengthening activities. We believe that consideration must be given to furthering this plan or in incorporating the strategic actions in the new plan to achieve some of the targets not yet realized. We commend the work of the quadripartite organizations in producing the One Health Joint Plan of Action 2022-2026 and look forward to its implementation. We commit to participate in regional discussions to guide its application for Jamaica and await guidance from PAHO WHO with respect to this plan. In the interim, however, we want to highlight that Jamaica is submitting a proposal to the Pandemic Fund that includes activities to enhance One Health capacities, to strengthen health systems and address antimicrobial resistance, and strongly urge the WHO to favorably consider and support small island developing states toward achieving this resilience. Chair, Jamaica is committed to strengthening core capacities under the international health regulations. Monitoring and compliance with the IHR is important to Jamaica, and achievements under the IHR contributed significantly to a strong COVID-19 response. We are also committed to work with the working groups on the amendments to the IHR and the negotiations of a new pandemic treaty. We ask, however, that the DG intervenes on behalf of small island developing states to ensure that there is adequate time to make contributions, bearing in mind our limited resources. We want to emphasize that we believe that the rush to complete the process puts us at a disadvantage and prevents our full participation in and contribution to the outcome. I thank you.
Thank you. Now the International Council of Nurses, followed by delegation of Turkey.
This is a constituency statement on agenda item 15.1. The co-signatories, the NSAs co-signing this statement are FDI World Dental Federation, FIP International Pharmaceutical Federation, ICN International Council of Nurses, WMA World Medical Association, World Physiotherapy, Women in Global Health, International Association for Hospice and Palliative Care, International Society of Pediatric Oncology, and the International Federation of Gynecology and Obstetrics. I'm speaking on behalf of the International Council of Nurses, which is part of the WHPA, the World Health Professions Alliance. WHPA's recent report highlights the evidence and knowledge gathered by its 5 organizations on the impact of the pandemic on health professionals worldwide. The report provides profound evidence of alarming occupational risks and pervasive workload challenges faced by the health workforce, particularly women, who make up 70% of the health workforce and 90% of frontline health workers. And it highlights the severe consequences they faced during the pandemic. Another report, also endorsed by WHPA, detailed the life-altering implications of workforce disruptions on pediatric oncology and proposed targeted recommendations. We emphasize the urgent need to protect and safeguard health professionals and thus to improve the resilience of health systems in health emergency planning and response. The health workforce is the fundamental resource that bridges health systems from response to recovery to delivery of essential health services and public health functions in the pursuit of UHC, global health security, and WHO cancer initiatives. We call on member states to strengthen mental health and psychosocial support for health professionals, both during and after pandemics and emergency situations. Properly responding to this need means providing timely access to care for individuals in need, but also organizational interventions that reduce risk factors, such as improving working conditions, ensuring appropriate training in anticipation of future health emergencies, including palliative care and nursing, and respecting health professionals' rights. Safe and supportive working environments also ensure the retention of qualified health workers to maximize the investments made in health education and training. Lastly, we urge member states to curate and invest in systemic strategies to concretely address chronic violence in healthcare settings, particularly that faced by women health workers, and to ensure health professionals' participation in national planning and policy and finance decision-making, again with a focus on women who are historically excluded from decision-making. This can ensure that on-the-ground expertise informs decisions and ultimately benefits both patients and health systems. Thank you very much.
Thank you. Now, Delegate of Turkey, followed by Delegate of Brunei Dar es Salaam.
Thank you, Chair. We also thank the IOAC, the DG, and the Secretariat for the comprehensive reports. Turkey has always been a supporter of a more stronger and operational WHO on the field to meet the critical needs of the member states, especially in times of health emergencies. In line with this, we are hosting a GDO for humanitarian and health emergencies in Istanbul. As can be clearly seen in the DG's report, we are witnessing a WHO which is becoming more operational by supporting the countries through emergency response coordination as well as through technical and logistical support day by day. Though it is not recorded in the DG's report due to time concentrate on the activity period which the report covers, Turkey has experienced extremely destructive consecutive earthquakes on the 6th of this February. We would like to take this opportunity once again to express our deepest gratitude to all emergency medical teams who have been with us under the coordination of the WHO on the field. This earthquake has been an important experience in terms of how important the emergency coordination during massive health emergencies is and to see the strengths and gaps in the mechanisms at hand. With these in mind, Turkey would like to express its support and stress the need to keep up the momentum in the negotiation processes for the relevant member state-led initiatives to strengthen the WHO's central technical leading and coordinating role in health emergency prevention, preparedness, response, and resilience in legal as well as operational terms. Having experienced well during the earthquake response in our country, we also urge the Secretariat to take into consideration the recommendations in the IOAC report and enhance the WHO emergency management accordingly. Thank you for your attention.
Thank you, Delegate of Turkey. Now, Delegate of Brunei, followed by Delegate of Iran.
Thank you, Chair. Chair, Excellencies, ladies and gentlemen, the COVID-19 pandemic has highlighted the gaps and challenges that countries face in implementing IHR effectively. Robust review processes must be in place, ensuring that technical assistance and resources are provided to countries with challenges. We congratulate the Working Group on amendments to the International Health Regulations 2005 on the significant progress made in work towards improving its implementation and compliance mechanisms. We believe these amendments are vital to ensure that this tool remains relevant, adaptable, and capable of effectively responding to evolving and complex public health threats. We will continue to work closely with the Working Group and other member states in this process. Since the IHR's entry into force, most of the focus of IHR capacities has been made at the national level. In particular, IHR core capacity requirements apply solely to member states. Moreover, currently, metrics for compliance are largely based on demonstrating national capacities. In order to ensure the continued relevance of IHR, Brunei Darussalam would encourage increased recognition of the importance of supranational or regional perspectives, particularly in terms of enhancing cross-border collaboration and identifying locally and regionally appropriate implementation strategies. Concurrent to the proposed amendments to the IHR is the ongoing negotiations of a new pandemic instrument that will ultimately redefine the global health security architecture. We believe this is timely and work on this should continue to be prioritized. However, in assessing compliance both to the IHR and the new pandemic instrument, Brunei Darussalam would urge the relevant bodies, states to carefully consider and balance the capacities and limited resources of small countries with competing priorities and avoid unduly burdening state parties with excessive reporting and evaluation. In assessing compliance, it is also important to distinguish non-compliance due to genuine inability to comply versus unwillingness or intentional non-compliance. Ladies and gentlemen, referring to the IOAC report, Brunei expresses concern that a key finding from this report is that despite the best efforts of the program and the executive director, the WHE program is overstretched, struggles to respond to the frequency of new emergencies, and would be significantly challenged in the event of a new pandemic like COVID-19. We urgently ask Secretariat if they agree with this finding and what their plans are to rectify this. In addition, we seek clarification from the Secretariat on a number of key points identified in this report. First, on the creation of the WHE Intelligence and Surveillance Systems Division and the WHO Hub for Pandemic and Epidemic Intelligence in Berlin. Can the Secretariat update the committee on their respective roles, the progress in operationalizing these new mechanisms, how they are linked, and plans to collaborate with member states' own epidemic intelligence and response systems? Second, on the discussions on the pandemic accord and amendments to the IHR, does the program have any recommendations for member states on specific items they wish to see included in this proposed text that could make their work easier and deliver better outcomes? Additionally, if the proposed changes do take significantly longer than expected and there is no agreement on these by the next World Health Assembly, does the program have contingency plan that still manages to deliver on some of the issues identified by these processes nonetheless? Third, on the pandemic fund and WHE's work in supporting countries who are applying for PPR investment, does the program have a plan for supporting countries who may not be eligible for the pandemic fund in securing resources for PPR capability building via other means? Turning to the DG's report on strengthening the global architecture for health emergency preparedness, response, and resilience, we welcome the strategic shift towards an ecosystem approach to health emergency and the elucidation of the 5 Cs as core health emergency components. On this, we wish to comment on the components related to community protection, safe and scalable care, and access to countermeasures. On community protection, we encourage the Secretariat to make explicit reference to the need for more and higher quality studies on the effectiveness of non-pharmaceutical interventions, particularly in responding to emerging infectious diseases. These studies should apply robust methodologies and allow policymakers to understand both the likely benefits and trade-offs associated with implementation of public health and social measures. On safe and scalable care, we would have liked to see an explicit reference to the need for investments in critical care capacity and how we can flexibly adapt healthcare systems so that critical care can be scaled up during a crisis. This issue is one which, even among the high-income countries, was a key limitation observed during the COVID-19 pandemic. On access to countermeasures, Brunei reiterates our commitment to equitable access to countermeasures, and we support WHO's work to establish interim coordination platform for countermeasures. We urge that countries with limited manufacturing capacities are not forgotten in the push for strengthening local manufacturing of health-related products, and we believe it is essential that a permanent multilateral mechanism be established to support global supply chains for health emergency-related products and technologies. In conclusion, Brunei Darussalam stands firmly with the health community in strengthening our global health security architecture. The ongoing work to strengthen implementation of the IHR and the Health Emergencies Program play an integral role in ensuring equity, transparency, building trust, and promoting solidarity among countries. We reiterate WHO is fundamental to strengthening prevention, preparedness, response, and recovery of health systems. In addition to its normative standard-setting function, we believe that in health emergencies in particular, there should be a strong operational function to WHO's work. We will play our part in accelerating the changes needed to make our world safer, and will support all multilateral efforts to that effect. Thank you, Madam Chair.
Thank you, Delegate Pranay. Now the Delegate of Iran, followed by Delegate of Australia.
We appreciate the Secretariat for organizing the document A7608 and A7609 revision point 1 with regard to agenda item 14.2, preventing, preparing for, and responding to public health risks and emergencies requires us to strengthen the core capacities for our health system at the national level. In most cases, the delay in events notification and risk assessment lies in the inadequacy of biosurveillance and technical capacities at the national level. To develop certain minimum core public health capacities, countries are encouraged to collaborate with each other in providing the required assistance through bilateral, regional, and multilateral channel in the spirit of Article 44 of the International Health Regulation. To effectively respond to future health challenges and emergencies and to strengthen the implementation of the International Health Regulation, we have to prioritize equity, multilateralism, international solidarity, and cooperation in our joint agenda. Guided by these principles and with due to respect to the sovereignty of member states, we can create an enabling environment for building health capacities and removing obstacles that generate global health challenges and inequalities. In the ongoing amendment process aimed at the strengthening of the International Health Regulation 2005, we actively continue our engagement in the process with the understanding that this process should not lead to reopening the entire instrument for renegotiation. The Islamic Republic of Iran will not support any measure that in any way undermines the sovereignty, security, and leadership of member states in health matters. The amendment process is an opportunity to member states to help operationalize the notion of equity and international cooperation with a view to promoting the universal application for the protection of all people of the world from the international spirit of disease and equitable manner. We continue our engagement in the IHR amendment process with this understanding that nothing will be agreed until everything will be agreed. With a view to enhancing sub-regional capacity to implement IHR, the Islamic Republic of Iran initiated G5 as a sub-regional health-oriented initiative to help improve the resilience of the health system at the sub-regional level with participation of Afghanistan, Pakistan, Iraq, and the World Health Organization and Tajikistan as an observer. During the COVID-19 pandemic, the Iran did not close its border even to seriously affected countries at the beginning of the outbreak, despite externally imposed restriction as a result of unilateral coercive measures. Due to Iran's robust PHC structure, the country managed to rapidly foster its national vaccination development plan capacity for COVID-19 through establishment of around 1,200 mass vaccination centers and reveal the developed countries' coverage in 6 months after the beginning of campaign. With regard to agenda item 14.1, as rightly mentioned in the document A7608, during a health emergency, especially a pandemic, the economic and political dimension are beyond the WHO capacities alone, and cooperation with partners is imperative and committees concerned regarding when the world would be better prepared for a new pandemic on the scale of COVID-19 in the future is sound and logical. Strengthening the capacity of member states, especially developing countries, long-term efforts, and until then, upon request of the involved member states, they rely on the support of the WHO. With regard to agenda item 15.1 and document A7610, WHO support in the following areas of importance to support countries to build a better architecture for HEPR. 1. Developing preparedness and response plan with all-hazard approach. 2. Compilation of international and integrate standard tools in risk assessment and risk management. Developing the advanced technology of early warning system, hazard mapping, damage and injury estimation, simulation exercise, and telemedicine, developing programs and tools for evaluating and improving health system resilience, supporting applied research related to risk reduction management. In A76.7 Revision 1, we argued that greater international collaboration and coordination are needed for efficient funding of agreed priorities and for multinational and multi-regional trials. However, some countries are facing challenges due to unilateral coercive measure of one developed countries with over-compliance of other developed ones, which make it difficult to improve new technology or receive grants from other countries to design high-quality clinical trials. Therefore, we highly recommend that a practical solution, or at least at a WHO resolution, to be adopted to address these challenges. Also, we acknowledge the need for greater capacity for clinical trials in lower-income countries with a focus on country leadership and equitable partnership for research in such country. Accordingly, we suggest WHO design a training program for low-income countries with the curriculum prepared by volunteer countries. Thank you, Madam.
Thank you, Delegate of Iran. Now, Delegate of Australia, then Delegate of Belize.
Thank you, Chair. I want to begin by echoing others' concerns on the late change in modalities compressing so many important agenda items into a single discussion. It is difficult for the Assembly to give real guidance on these critical issues working in this way. In the time available, we will make 7 points for the 5 sub-items. First, Australia recognises and reaffirms the central leadership of WHO in coordinating and responding to numerous large-scale emergencies, while also building capabilities for prevention and preparedness. We acknowledge that health emergencies are increasing in regularity and intensity, and we remain deeply concerned that this important work has been constantly hampered by funding gaps and lack of capacity. The report of the Independent Oversight Advisory Committee is a sobering reminder of how overstretched the WHO program is, putting at risk the critical work and the well-being of the staff who do it on our behalf. Second, we echo the IOAC in emphasising that action must be taken to equip WHO with the necessary resources and authority to ensure the health emergencies program is fit for purpose. This includes a sustainably funded core budget with adequate resourcing at all levels, as well as the necessary accountabilities and lines of authority between the Director General, regional directors, the WHO Executive Director, regional emergency directors, WHO representatives and incident managers. Continued prioritisation of prevention of and response to sexual exploitation, abuse and harassment is also essential. Australia urges swift action on the IOAC's recommendations to ensure the WHO program can do what the world expects of it. Third, we share the IOAC expectations that the new Standing Committee on Health Emergency Preparedness and Response will play an important role in driving this action. The committee should facilitate and monitor implementation of the IOAC recommendations, working to support the WHO where necessary authority and resources to coordinate preparedness, response and resilience. Fourth, we acknowledge the Secretariat's request for guidance on how to continue to support Member States in strengthening IHR implementation, including through national action plans for health security, use of data-driven tools to build sustainable preparedness, and expanding capacities in the priority areas identified in the One Health Joint Action Plan. Although we cannot give detailed guidance in this discussion, we do want to stress the urgency of redoubling efforts to support IHR core capabilities and capacities, drawing on lessons learned from the COVID-19 pandemic and existing monitoring and evaluation tools like JEE. The process of considering proposed amendments through the working group on IHR should not slow or detract from these efforts, and the amendment process must focus on changes we can make collectively to strengthen implementation and compliance. We encourage Member States to leverage available financing mechanisms, including the Pandemic Fund, to accelerate IHR implementation. We also highlight the value of cooperation exercises to test and strengthen coordination and cooperation between the national focal points, such as the Western Pacific region's IHR exercise Crystal. Fifth, we welcome the Director General's proposal to strengthen the global architecture for health emergency preparedness, response and resilience, noting we are still considering the updated paper released only a couple of days ago. Australia appreciates the Secretariat's efforts to move with urgency to advance reform initiatives and support Member State needs, drawing on lessons learned from the pandemic. We encourage you to continue this work in line with existing mandates, but also to focus on coordinated support to ongoing Member State processes addressing many aspects of the 10 proposals. Your proactive provision of information and advice to the INB and the WGIHR is essential to ensure our decision-making is informed by the latest developments and best available evidence. We stress the importance of accelerating momentum to deliver on the INB and WGIHR mandates, and of course, fully aligned with the statement delivered by Indonesia on behalf of MICTA in this regard. Sixth, we want to commend Oman and Switzerland for the leadership on the development of the Global Health for Peace Initiative roadmap to address the health needs of populations in post-conflict recovery, especially for those who are most vulnerable. We also reiterate our support for the work to strengthen clinical trials. And finally, Chair, we reiterate Australia's condemnation in the strongest possible terms of Russia's illegal and immoral invasion of Ukraine. Russia's attacks on healthcare infrastructure deprive people of urgently needed care, endanger healthcare providers, and undermine health systems. We appreciate WHO's continued efforts to support the humanitarian emergency response and strongly urge all Member States to support Ukraine's decisions on health emergency in Ukraine and refugee receiving and hosting countries stemming from the Russian Federation's aggression. Thank you, Chair.
Thank you, Delegate of Australia. I now give the floor to Delegate of Belize, followed by Delegate of Norway.
There you go. Thank you, Madam Chair. Belize thanks the Director General for the reports on items 14.1, 14.2, 15.1, and 15.2. The COVID-19 experience holds us responsible to acknowledge the global emerging and re-emerging diseases. These threats do not discriminate nations nor people. We now have been placed at a new starting point whereby we have the opportunity to rebuild a more robust health system. I must acknowledge the support from PAHO as they accompanied us step by step as we traverse this mortal experience. The impact of this pandemic will live with us for the next decades. As of now, we need to retake the path of preparedness along with our key partners and stakeholders. An immediate challenge we need to address is to reinforce the sustainability of our efforts in the areas of laboratory services, information systems, diagnostic imaging, and people-centered healthcare services. The Ministry of Health and Wellness in Belize is committed to join hands with national and UN entities who have a role in the responsibility of creating a level of country preparedness in order to ensure a timely and effective response for future pandemics. The COVID-19 pandemic revealed the gaps in our health system. It is our sacred duty as public health leaders to be on the forefront using the lessons learned from this recent pandemic to strengthen and support all entities who are on the vanguard of administrative and technical services. Belize also notes the challenges being faced regarding the implementation of the core capacities of the international health regulations and the coordinated approach for the management of acute public health emergencies. While many strides have been made, we still face challenges in laboratory capacity and surveillance, health emergency management, and infection prevention and control. Furthermore, there is also great need for strengthening the areas of policy, legal and regulatory frameworks, norms and standards, human resource capacity, risk communication, and surveillance systems. To address some of these areas, Belize's recent accomplishment is further strengthening and making more functional the One Health approach makes the country better prepared to detect, prevent, control, and respond to health emergencies. The inauguration of the virtual platform in November of 2022 to facilitate information sharing for better decision-making places the country at the cutting edge of innovation and high-level adaptation during an era when information sharing is one of the most important elements during the response to any health event. Through the One Health initiative, the government of Belize is making significant progress in its endeavor of promoting, improving, and defending the health and well-being of all species by enhancing cooperation and collaboration between relevant stakeholders in the human, animal, and environment interface. Furthermore, the intersectoral collaboration will foster leadership and management to achieve these goals. It will also improve the response to future pandemics and outbreaks. As we seek to improve our capacities for pandemic preparedness and response, Belize could benefit from technical cooperation to strengthen its IHR core capacities and the establishment of a national interagency committee to monitor and facilitate the strengthened implementation of the IHR. Going forward, as we aim to be better prepared to detect, prevent, control, and respond to future health emergencies and work towards health system strengthening, we must enhance cooperation and collaboration to have the necessary resources and capacities to achieve greater health gains. Belize remains fully committed in working towards this. I thank you.
Thank you, Belize. Now the floor for Norway, followed by Colombia. Delegate of Norway, please.
Thank you, Chair. On the report from the Independent Oversight Advisory Board, we share many of the concerns, in particular regarding the need for stable and predictable financing to make the program's operations suitable and to ensure long-term contracts for staff. We are pleased that the more sustainable financing of WHO is an issue which will be advanced by this Assembly. Further, we would like to highlight IOAC's recommendation to ensure gender balance in leadership positions, including at the country offices, and need to assure trust in the internal systems by providing accountability, in particular regarding cases of sexual misconduct. On the implementation of the IHRs, Norway attached great importance to the IHRs. The ongoing revision should ensure that they are made an even more effective tool and a strong legal framework for preparedness and response. It is also important to underline countries' common responsibility, both in terms of support to WHO and to each other, established in Article 44. Global health security should be seen as a global public good. We thank the Secretariat for the report listing ongoing initiatives aimed at strengthening the global architecture for health preparedness and response. We underline that WHO's normative and leading roles must be duly taken into account whenever member states discuss improvements to the global health architecture. We also underline that the foundation for safe and scalable care is universal health coverage. We must keep in mind how WHO, the Pandemic Treaty, the Pandemic Fund, and the other global health initiatives can better support and incentivize strengthening health system and achievement of universal health coverage. In the Johannesburg process, South Africa and Norway have, alongside the interested stakeholders, discussed what more equitable access to countermeasures may look like. Any future countermeasure platform should be able to give effect to principles and commitments established through the pandemic agreement. On WHO's work in humanitarian emergencies, we commend WHO and its staff for their tireless efforts across the globe, saving and protecting lives. Protection of civilians, including healthcare workers, is a priority. Women and girls are often the first victims, including of sexual and gender-based violence. We commend WHO's efforts to address these issues, including through WHO's program of surveillance and documentations of attack on health, and it provides accountability. We encourage WHO to continue mainstreaming gender and peace responsiveness and conflict sensitivity in its programming. We expect that these important principles will also be included in the coming Roadmap for Global Health for Peace initiative. Norway has supported the WHO since its inception, and in particular its contingency fund for emergencies to enable WHO to respond to emerging crises on short notice. This year we will increase our contribution to the CFE. Non-earmarked, flexible and predictable financing is at the heart of effective humanitarian action because in health emergency, every hour counts. Finally, on the implementation of Resolution WHI 75/11, the report underlines the continuing consequences for the health of Ukrainian citizens due to the Russian invasion of Ukraine. We condemn Russia's unjustified and unprovoked aggression against Ukraine in the strongest terms. The continued attacks on civilians and civilian infrastructure, including healthcare facilities, are of grave concern. Ukraine and its population have our full and unwavering support. Norway supports the proposed decision put forward by Ukraine for the Director General to continue reporting on the consequences for health and access to health care services in Ukraine, in line with the implementation of WHI 75/11. The decision point is a logical step, having in mind the continued aggression on Ukraine by Russia. It is therefore highly inappropriate and unfortunate that Russia has proposed a new resolution. Under the guise of neutrality, Russia's draft resolution attempts to absolve the Russian Federation of all responsibility for its invasion of Ukraine and the health emergency it triggered. The draft resolution is, if adopted, undermines the work of the Assembly and the Secretariat. We encourage Member States to vote against Russia's draft resolution. Thank you.
I thank the delegate of Norway, and now I give the floor to delegate of Colombia, followed by delegate of Vietnam.
Muchas gracias, señora presidenta.
Thank you.
En términos generales, queremos plantear que, aún tomando medidas específicas en materia de reglamento sanitario, arquitectura mundial, hoja de ruta, en salud y paz, mejoramiento de capacidades de ensayos clínicos, todo muy importante, es vital que entendamos que estos procesos deben tener la mayor consulta y discusión posible que debe continuar en el tiempo, y que los principales desafíos para una verdadera prevención de nuevas emergencias y desastres y pandemias tienen que ver con, uno, el desarrollo impostergable de sistemas universales, públicos y gratuitos hacia la equidad, la intervención acelerada para mitigar y adaptarnos al cambio climático en clave de justicia climática y del desarrollo de una sola salud. Anteponer la soberanía sanitaria en función de la salud pública y el derecho fundamental a la salud a las lógicas del mercado. Profundizar la participación popular vinculante para una verdadera gobernanza global. Asegurar que sea la ciencia, la epidemiología y la salud pública las que orienten las decisiones más allá de cualquier otro interés. En este marco, en relación con el RSI, sostenemos que no ha terminado de ser implementado, en particular en lo relacionado con vigilancia en salud pública. En cuanto al Comité de Implementación y Cumplimiento, creemos que debe enfocarse en la aceleración de la implementación y la nivelación de las capacidades de los Estados. El RSI debe hacer énfasis en recuperar o desarrollar la soberanía sanitaria, en la que la salud pública y el derecho fundamental a la salud sean el centro por encima de lógicas restrictivas. La acción de la Comisión debe acompañarse de apoyo financiero y técnico de manera vinculante. Consideramos que en vez de mecanismos sancionatorios debemos avanzar en incentivos para evolucionar y madurar las capacidades de los Estados. El Reglamento Sanitario Internacional debe ser más preventivo y predictivo, de tal manera de mejorar su capacidad de detección temprana, generación de alertas y respuestas rápidas a amenazas. En relación con los ensayos clínicos, la armonización de buenas prácticas clínicas no debe ir en contravía del desarrollo de las capacidades locales en investigación clínica según los contextos, las necesidades territoriales y comunitarias. Estamos de acuerdo con la coordinación y cooperación internacional, incluso la generación de un sistema de indicadores de investigación clínica. Será muy importante que conozcamos y participemos de las estrategias para fortalecer el desarrollo de ensayos clínicos a nivel global. Las metodologías y los tiempos no deben vulnerar los derechos de los participantes en estos ensayos, incluida la devolución de la información. En torno a la Iniciativa Mundial de Salud para la Paz, la celebramos y nos suscribimos en tanto Estado que avanza en la implementación de acuerdos de paz y en la construcción de una paz total. Consideramos que la paz no solo es el silencio de las armas, sino la superación de las causas sociales, económicas y políticas de los conflictos, la restitución de los derechos de las víctimas y la instauración de sistemas universales, públicos y gratuitos de salud con adecuación territorial y cultural. Sin salud no hay paz y sin paz no hay salud. La OMS se debe a la paz y debe trabajar para ella. Para ello debe impulsarse el multilateralismo, evitar cualquier señal de legitimación de las agresiones vengan de donde vengan y fortalecer la autoridad moral para servir de puente entre las partes enfrentadas y para evitar o disminuir el sufrimiento de las víctimas. Debemos trabajar en la prevención de los conflictos, en evitar el escalamiento de los actuales y en la restauración de sistemas sanitarios postconflicto. En lo que tiene que ver con la arquitectura mundial para la preparación, respuesta y resiliencia frente a emergencias sanitarias, aunque son puntos importantes para estar preparados para futuras emergencias sanitarias, es fundamental resaltar nuevamente que estas propuestas deben coordinarse con las negociaciones actuales en las cuales estamos inmersos, como lo son las enmiendas del RSI y el CA+, y que deben culminar en menos de un año, y para lo cual los esfuerzos de todas las delegaciones deben estar enfocadas para generar una estructura coherente que nos permita actuar coordinadamente y efectivamente ante una emergencia sanitaria y prevenir y actuar ante inminentes pandemias. Una respuesta adecuada a nuevas emergencias sanitarias y próximas pandemias requiere que toda la arquitectura esté bien estructurada y coordinada. Frente a estas situaciones, las actuaciones céleres son críticas para poder generar una respuesta. En este sentido, Colombia insiste en la importancia de situar la equiidad en el centro de estas negociaciones. La arquitectura debe proveer respuestas concretas para los países en vías de desarrollo que requieren acceso a contramedidas médicas, tecnología y construcción de capacidades para estar mejor preparados. En este punto, Colombia también invita a los países y sus oficinas regionales a estar más involucrados en los procesos de negociación, bajo el entendido que su conocimiento y experiencia in situ respondan a los ajustes que requerimos hacer después de lo que experimentamos luego de 3 años de pandemia con el COVID-19. Muchas gracias, Presidente.
Thank you, Delegate of Colombia. Now, Delegate of Vietnam, followed by Delegate of Iraq.
Thank you, Madam Chair. Vietnam delegation is pleased to acknowledge the WHO Informatics report, which highlights achievements and challenges identified in durations of preparedness and response to the various public health emergencies, including the existing COVID-19 pandemic over the world. The report addressed research, innovations conducted, and also the guidelines that have supported to the member states in strengthening their capacity of public health emergencies preparedness and response. WHO are kindly requested to continue providing technical and financial support to member states on the following priorities: development and implementation of the National Action Plan for Health Security 2023 and 2027 as soon as possible, with high commitment and active involvement by the government on the basis of multi-sectorial collaborations and cooperations and in orientation of the One Health approach. The second, dynamic preparedness matrix tool is a new tool to measure the preparedness capacity and inform key action plans for improving the capacity as required by the IHR. It seems to be not well known by many countries, including Vietnam. Therefore, it is kindly requested that the tool should be disseminated and used at the regional and national level so as to help countries and regions to enhance the implementation of the IHR. Third, development of the One Health Joint Action Plan at national level with 6 priorities as identified. As implementation of the action plan requires strong collaboration and cooperation amongst health, animal health, and environment sectors. Therefore, it needs a triple-party collaboration and cooperation mechanism, an information sharing and reporting system, a sustainable interaction and working environment, including facilities, equipment, and human resources. Regarding to the implementation of the international health regulations, Vietnam highly appreciates the great effort of the WHO Secretariat in completing a very comprehensive and meaningful report on the implementation of the international health regulations, which highlight achievements and gaps identified in the past years. Global health experience in the COVID-19 pandemic, prevention and control reveal many gaps and weaknesses in supporting the member states in the preparedness and response to the pandemic under the IHR. So we believe that the adjustment to the IHR will bring more benefit for the member states to know the way to continue maintenance and strengthening of our capacities in preparedness and response to pandemic and public health emergencies in compliance with the IHR requirements. In this regard, we would like to propose that amendment of the IHR should address enhancing effective implementation and compliance of the IHR, of which high-level command and control of the government using the whole of the government and the whole of society approach should be taken into account as one critical element for strengthening the state members' strong commitment and engagement in continued implementation of the IHR. WHO Secretary is kindly requested to continue supporting technically and financially to member states on strengthening the implementation of the IHR in the next 2 years, with much focus on the following. First, strengthen roles, responsibilities, and competencies of the national focal point for IHR, for more effective coordination of the multi-sectorial collaboration and cooperation in the implementation of the IHR, to enhance communications, information sharing, and collaboration among sectors involved in response to the public health emergency within a country toward the One Health approach. Continue to maintain and strengthen point of entry capacity for preparedness and response to health emergency to meet higher requirements as given in the indicators related to border health and point of entry. With this regard, we recognize the importance of strengthening collaborations between health sectors to enhance point of entry capacity both in routine basics and duration health emergency. The COVID-19 no longer constitutes a public health emergency of international concerns, so it is right time for the country to prepare for and conduct the joint external review of the IHR implementation progress in the next 2 years, which would result in value gaps, weakness, and recommendation to the countries for their continued enhancing the implementation of the IHR. As such, this whole process needs much technical and financial assistance from WHO. By these occasions, it is kindly confirmed that Vietnam is always committed to continue strengthening the national health system capacity and take full responsibility as an active member state in building trust, solidarity, and collaboration in the WHO and in the international community in the fight against threat of any pandemics or public health emergencies. So thank you, Madam Chair.
Thank you, Delegate of Vietnam. Now, Delegate of Iraq, followed by Delegate of Zimbabwe.
Madam Chair, regarding item 14.2, Iraq adopted IHR during the 58th Assembly in 2005 and legislated in 2007 through Iraqi Parliament, and working towards the achievement of health security through efficient efficient implementation of regulations and working to enhance existing capacities through implementation of JEE and SPAR. Iraq faces several challenges in meeting IHR requirements, such as security issues, limited resources, and weak health infrastructure. However, Iraq has also demonstrated its commitment and resilience in addressing public health threats like polio, cholera, COVID, and other notifiable health events. The challenges we face also annual multiple mass gathering during which millions of people per year visit Iraq from all over the world. Frequent outbreaks of communicable diseases which overwhelm the health system and pose a risk of cross-border transmission. The IDP situation in Iraq is a complex and protracted humanitarian crisis. Weak coordination and collaboration among different sectors, agencies, and stakeholders involved in health security plan. WHO and other partners invited to strengthen the implementation of core capacities to support border activities during mass gatherings with all involved countries to outline the health procedures, to provide technical assistance and guidance to improve compliance with IHR requirements and obligations. Regarding item 15.1, Madam Chair, Iraq highly commits health for all by all as integrated and coordinated, coherent national, regional, and global efforts are important to prevent and control pandemics. The health system in Iraq has been exposed to exceptional challenges over the past few decades. Health infrastructure has been considerably damaged, and many of the skilled health professionals have left the country, leaving behind a population with inadequate access to basic health care services. With the severe and lasting impact of ongoing COVID pandemic and to review Iraq's preparedness capacity to respond to future health emergencies, the government of Iraq officially requested to be among the pilot countries to conduct the Universal Health and Preparedness Review Mechanism, which included a risk assessment to identify countries' potential hazard using WHO strategic tool for assessing risk. The review addressed governance, leadership, agile and strong system for emergency preparedness and resources. Many challenges, gaps, and best practices are identified. For instance, limited multi-sectorial, multi-stakeholder coordination at all levels, varied capacities across the different administrative divisions and governmental sectors, and among different geographical locations, and a country donor focus on humanitarian emergencies response rather than on recovery. In addition to health security preparedness were also among the identified challenges. The government is currently working on a roadmap and a long-term plan of action to respond to the identified gaps and recommendations towards strengthening the health system and national health security through evidence-based planning, implementation, and monitoring progress in priority areas, like first, strengthening the health information system as an entry point to health system strengthening in Iraq. Henceforth, Iraq, in collaboration with WHO and other partners, has been putting more emphasis to strengthen Iraq HIS in terms of aggregate case-based data with an aim to ensure implementation of user-friendly and a local sustainable digital system. A foundational investment is required to upgrade the national health surveillance system to electronic form, ensuring its outreach to all levels with real-time data reporting against the core indicators in addition to event-based surveillance. Second, developing a long-term 5 to 10-year national health development plan defining priorities of the country aligned with Iraq Vision 2030 regional and global priorities, including universal health coverage through primary health care, health security through ability to detect, prevent, and respond to threats, and health promotion through building health public policy and community empowerment. Review essential public health functions to align organizational structure with national goals to advance universal health coverage and health security. establish Iraqi National Institute of Health, strengthening health promotion capacity accomplished by building healthy public policies, creating supportive environments, strengthening community action and personal skills, and creating a space for two-way community engagement, updating National Action Plan for Health Security, develop multi-sectoral One Health Advocacy Committee and Work Plan, production of investment case of WHO, World Bank, FIF. Thank you.
Thank you, Delegate of Iraq. Now I give the floor to Delegate of Zimbabwe, followed by Delegate of Laos.
Thank you, Chairperson. As Zimbabwe, we align ourselves with the statement made by the United Republic of Tanzania on behalf of the African region. Zimbabwe has made progress to strengthen IHR core capacities, but more needs to be done for all African countries. As we continue to plan for future pandemics, the focus should be on a One Health and multi-sectorial approach. This should be supported by sustainable domestic financing, equitable distribution of medicines and commodities, while developing local capacities for vaccine production in Africa. The COVID-19 pandemic response in Zimbabwe was government-led and multi-sectorial and relied strongly on domestic funding with complementary development partner funding. Zimbabwe decentralized the laboratory capacities for COVID-19 diagnosis and management to all 8 rural provinces. A national public health emergency operations center was established, and work is ongoing to establish the same in all provinces. We developed capacity for COVID-19 genomic sequencing in the country, and plans are to increase capacity for genomic sequencing to cover other disease pathogens. The often neglected but critical role of infection prevention practices and practitioners in pandemic responses was evident during this pandemic. Zimbabwe experienced the challenges with human resources for health in various core competencies. The need for training of healthcare workers becomes important. Zimbabwe acknowledges the international health regulations as a legally binding agreement, requiring countries to develop capacities to detect, assess, report, and respond to public health emergencies. We applaud the move to revise the IHR 2005 to be more flexible, future-oriented, and progressive, requiring that all countries consider the possible impact of all hazards, whether occurring naturally, accidentally, or intentionally. I thank you.
Thank you, Delegate of Zimbabwe. Now Delegate of Laos, followed by Delegate of Mexico.
Thank you, Madam. Laopedia has appreciated the IHR 2005 to facilitate timely information sharing on public health events globally. Thus far, Laopedia is committed to implementing the IHR 2005 through the 5-year National Work Plan for Health Security that is guided by the Asia-Pacific Strategy for Emerging Disease and Public Health Emergencies, which is currently under discussions for renewal, at a solid foundation to guide and support strengthening the country's core capacities to address public health emergency, including during the COVID-19 pandemics. The IHR monitoring and evaluation frameworks is applied regularly and routinely through the review and submission of the ISPA, simulation exercise, and intra and after action reviews to identify needs and priorities that are incorporated into the National Work Plan for Health Securities. These ongoing efforts using the ME frameworks is an opportunity to continue to strengthen implementation of the IHR. From COVID-19, health security requires a whole of governments and whole of society approach. It is important to continue to advocate and engage with non-health sectors and communities. Our National Work Plan for Health Security is multi-sectoral. However, there is always an opportunity to strengthen multi-sectoral coordinations and collaborations. A resilient health system is the foundation for public health emergency preparedness and response, And we do believe that having a long-term investments in system strengthening will support the implementation of IHR. We also acknowledge and appreciate the strategies, guidance, document, and action plan that the Secretariat have supported in developing and disseminating to accelerate the implementation of our national health security work plans. LAPD appreciates continuous WHO support from countries and also regional levels on implementing the IHR. I do thank you, Madam Chair.
Thank you, Delegate Flau. Now, Delegate of Mexico, followed by Medicines for Malaria Venture.
Gracias, señora presidenta.
Thank you, Madam Chair.
Hace unos días, el director general declaró el fin de la emergencia sanitaria global de la COVID-19. Una de las grandes tragedias de esta pandemia, mencionó el doctor Tedros en su discurso, es que no tenía por qué haber sido así. La pandemia reveló la fragilidad de nuestros sistemas de salud y los vacíos globales en la preparación pandémica que decenas de expertos habían advertido por años. También evidenció los desafíos del multilateralismo en el contexto político actual y las limitaciones de sus instituciones, incluyendo a la OMS. Fue claro que la falta de coordinación global, así como la ausencia de equidad y solidaridad, impidieron una mejor respuesta. Sin embargo, la OMS y otros organismos establecieron sobre la marcha mecanismos de apoyo para sus Estados miembros. También facilitaron el intercambio de información y espacios de diálogo entre actores relevantes, incluyendo a la comunidad científica, que hizo posible el fin de la emergencia. Esto es un ejemplo de que el multilateralismo no es solo un discurso político, sino un método práctico de cooperación para proteger nuestro interés nacional. Señora Presidenta, cientos de recomendaciones se han presentado en los últimos 3 años sobre cómo evitar un desastre de la dimensión de la COVID-19. Los documentos que revisamos el día de hoy contienen nuevas recomendaciones y nuevos llamados para que la OMS y sus Estados miembros adopten medidas al respecto. Sobre estos, queremos señalar de forma general los siguientes 4 puntos. Primero, numerosos grupos e iniciativas dentro y fuera de la OMS han comenzado procesos para solucionar las brechas en la arquitectura mundial de la salud. Nos parece acertada la recomendación del Comité Independiente de Asesoramiento para que el Secretariado nos ayude a reunir la información sobre estas iniciativas, a coordinar los esfuerzos entre los distintos actores y a evitar la duplicación de acciones. Esperamos que el Secretariado pueda presentar una propuesta al respecto. Segundo, reiteramos que las iniciativas que se describen en el documento sobre la arquitectura internacional en salud del director general deben ser debatidas a detalle por todos los Estados miembros antes de ser adoptadas. Además, el establecimiento de las propuestas más ambiciosas debe ser responsabilidad de los órganos de gobierno. Solo de esta forma aseguraremos su sostenibilidad y legitimidad en el largo plazo. En este punto, consideramos importante que la Organización Panamericana de la Salud participe activamente en el desarrollo de estas propuestas para que se reflejen los retos específicos de nuestra región y las lecciones aprendidas con la COVID-19, en especial en lo que se refiere a una nueva plataforma sobre contramedidas médicas. Esperamos que esta participación se concrete a partir de ahora. Tercero, en lo que se refiere a cómo mejorar la aplicación del Reglamento Sanitario Internacional en los años previos a la adopción de las enmiendas que estamos negociando, México considera que contar con un catálogo que identifique claramente las oportunidades de colaboración y asistencia por parte de la OMS puede ayudar a organizar mejor el apoyo dependiendo de las necesidades de cada país. El trabajo del Secretariado del reglamento se apoya de distintas áreas de la OMS. El catálogo puede ayudar a dirigir mejor las solicitudes de asistencia de los Estados parte. Cuarto, tenemos un desafío muy grande en los siguientes meses con los procesos para establecer nuevos compromisos legales en materia de emergencias sanitarias. Sobre estos procesos, nos alineamos con la intervención realizada por Indonesia en nombre de los países que formamos parte de MICTA. Reiteramos que se trata de una oportunidad para establecer un nuevo entendimiento global en el tema, en especial en cuanto al acceso equitativo a productos médicos, la aplicación del enfoque Una sola salud y la gobernanza en salud. Para ello, es necesario que los Estados alcancemos un acuerdo práctico y relevante y no únicamente un documento con buenas intenciones. Señora Presidenta, sabemos que habrá una próxima pandemia. Los cambios que se realicen en este periodo post-emergencia dependen de nosotros. La responsabilidad es nuestra. La próxima vez no tiene por qué repetirse lo que ocurrió en los últimos 3 años. Gracias.
Thank you, Delegate of Mexico. Now, medicines for malaria, Venture, followed by Pakistan.
This is a constituency statement under Agenda Item 15.1. Our constituency includes Global Health Council, International AIDS Society, the International Union of Tuberculosis and Lung Disease, Medicines for Malaria Venture, PATH, and Women in Global Health. As a group of nonprofit innovators, product development partnerships, advocacy, and convening organizations whose mission is to accelerate research and development for diseases of poverty, we commend Resolution 75.8 on strengthening clinical trials and the actions undertaken by the WHO Secretariat so far to implement this resolution. Women, girls, and other gender-diverse persons of childbearing potential remain vastly underrepresented in research and clinical trials, particularly during pregnancy and lactation. At a time of rapid medical innovations, this limits data, prevents understanding of sex and gender-based differences in health outcomes, and restricts the availability of therapeutic options for more than half the global population. We must urgently change this. To fill gender equity gaps in research, we look forward to WHO's guidance on best practices for clinical trials specifically focused on pregnant and lactating women, girls, and other gender diverse persons of childbearing potential. Data collection in these populations should be encouraged through existing pharmacovigilance programs and active pregnancy registries spanning all diseases. Clinical research programs should be designed to intentionally recruit these populations in trials and disaggregate data by sex, age, and gender. The anticipated release of guidelines on the inclusion of pregnant and breastfeeding individuals in clinical trials by the International Council for Harmonization of Technical Requirements for Pharmaceuticals for Human Use will certainly help move this agenda forward and speed progress towards addressing the health needs of these underrepresented populations across countries and diseases. Our organizations are committed to continue working with WHO and the member states to include specific measures concerning women, girls, and other gender-diverse persons of childbearing potential during pregnancy and lactation in the upcoming guidance on best practices for clinical trials, anticipated to be available by the 77th World Health Assembly. Understanding the burden of disease in these important populations is critical to estimate maternal morbidity and mortality, evaluate and implement effective programmatic interventions, and advocate for sufficient resources. Together, we can help address this major historic blind spot in public health. Thank you.
Thank you. Now, Delegate of Pakistan, to be followed by Delegate of Zambia.
Thank you, Chair. Pakistan supports the joint statement of Emro region on health emergencies given by Saudi Arabia. Pakistan recognizes the significance of WHO's work during health emergencies and commends the organization's leadership in raising awareness and in mobilizing support for equitable and affordable access to diagnostics, therapeutics, and medicines. We would first like to thank WHO and the global community for coming together in aid of Pakistan during its massive flood relief activities and were able to reach to millions of people who were in dire need of essential medicines and urgent medical supplies through medical camps. Pakistan critically benefited from WHO's early rapid risk assessment and response efforts. Government considers implementation of IHR 2005 as a priority agenda of health sector. It is cognizant of the fact that building and sustaining essential public health core capacities of health security are critical for national, regional, and global response to public health events. Chair, while COVID-19 is no longer a public health emergency of international concern, yet it will continue to impact the lives of many. The COVID-19 pandemic has demonstrated that the public health systems across the countries have not only been challenged, but also tested the capabilities of other One Health stakeholders and reflected on the level of preparedness against the pandemics and public health events. Pakistan, with the support of WHO, is currently undergoing the second round of joint external evaluation in order to see the progress made since 2016 and to identify gaps and provide recommendations against the 19 technical areas of public health systems, which will enable us to develop the health security plan. Therefore, we need to remain committed to cooperation and assistance during the implementation phase across the country. We welcome the proposal by the Director General to tackle future health emergencies based on the principles of coherence, equity, and inclusivity. These principles must remain the cornerstone of our future work on preparedness and response to further health emergencies. Mobilization of international funding like Pandemic Preparedness Fund and others, along with domestic public resources, along with private financing, are essential to develop resilient health systems which are better prepared to prevent, detect, and respond, and navigate safely through future international emergencies. Pakistan has been productively engaged in the ongoing processes of strengthening global health infrastructure through our existing health security plan. In this regard, the government, based on Joint External Evaluation 2016 recommendations, has taken several important steps through its domestic resources, as well as with the technical support of health development partners to strengthen emergency preparedness and response. Few areas include implementation and strengthening integrated disease surveillance and response system, workforce development, expansion of public health lab at the subnational levels, national program for AMR and IPC, and enhancing capacity at port of entries for screening and detection of cases. We believe that by building resilient health systems for health emergency management, country will be able to effectively respond to health emergencies. These processes remain critical to guide the future work of WHO and providing a framework to combat future health emergencies. WHO's contingency fund for emergencies provide critical lifeline during health emergencies, such as in Pakistan, which significantly benefited from the fund during the last year's floods. Yet, additional avenues of financing and supporting mechanisms are essential to prevent future health risks and emergency. We continue to underline that the future architecture to prevent and respond to public health emergencies must be an equity-based system, as no one is safe until everyone is safe. I thank you, Chair.
We thank the delegate of Pakistan, and now I give the floor to the delegate of Zambia, and to be followed by the delegate of New Zealand. Thank you.
Thank you, Chairperson. Zambia aligns this statement with the one made by Tanzania, We start by thanking the Director General for the leadership and the entire WHO Secretariat for the support provided to member states generally and Zambia in particular. Zambia has benefited from the World Health Emergencies Program in various ways, including compliance to international health regulations, response to public emergencies like COVID-19, cholera, polio preventive measures, and campaigns. The lessons learned from the COVID-19 pandemic is a reminder of the need to further invest in health systems, ensuring universal health coverage, as well as strengthen emergency preparedness and response. The experiences underscore the importance of having resilient health systems and enhanced primary health care services, particularly to the underprivileged and vulnerable populations. Zambia had the privilege to access the COVID-19 vaccines and subsequently managed to successfully vaccinate more than 8% of the eligible population and hence provided significant protection for her population. This has resulted in a huge impact on our COVID-19 mitigation measures. As a country, we have continued to strengthen pandemic prevention, preparedness, and response. Currently, we are mobilizing resources from various funding opportunities such as the Pandemic Fund, the Global Fund, and others. We continue to heighten the disease surveillance and early warning systems, implementation of International Health Regulations 2005, and have set up an effective and functional national IHR focal point. Further, the country is also strengthening the implementation of the One Health approach by enhancing multi-sectoral coordination as a way of ensuring reduced risks posed by emerging zoonotic diseases. Chairperson, allow me to emphasize that many of the emergency conditions we face, such as cholera, typhoid, and others, have their disease determinants outside the scope of the health sector. It is therefore important that the multi-sectoral approach to prevention is strengthened with water and sanitation sectors. Without addressing universal access to safe drinking water and improved hygiene, we will continue to experience such outbreaks. We therefore encourage the Secretariat to continue providing the necessary tools and support, bearing in mind the limited resources in view of multiple public health threats and other routine expectations. Zambia continues to commit to working with the Secretariat and other relevant stakeholders in addressing public health emergencies. I thank you, Chair.
I thank the delegate of Zambia, and now I give the floor to the delegate of New Zealand, and to be followed by the delegate of Senegal.
Thank you, Chair, for the opportunity to address these important issues. As our colleagues have noted, it is difficult to address the breadth and importance of these topics in the time made available for this cluster, but we will do our best. Aotearoa New Zealand appreciates the opportunity to address the WHO's broader programme of work to strengthen our public health emergencies preparedness and response capabilities. While the fake for COVID-19 may have ended, Member States are still grappling with the impacts of the pandemic. Ensuring that we as a global community are equipped to prevent, prepare and respond to the next pandemic is at the forefront of our minds. New Zealand is proud to serve as co-chair of the Working Group on Amendments to the International Health Regulations and to contribute to improved health emergency preparedness and response in this way. Turning to the implementation of the IHR over the next 2 years, we urge Member States to take every opportunity to address equity both within countries and across countries, including by supporting capability and capacity building in developing countries via bilateral, regional and other arrangements. A process of continuous improvement is required of states parties, and we must all commit to strengthening the core capacities described in the IHR. Maintaining and enhancing the functionality of our national IHR focal points, or NFPs, which have proven to be a critical communication channel through the COVID-19 pandemic, will be important here. In our own region, we would like to acknowledge the exemplary work underway in the Western Pacific and Southeast Asian regions to further develop the Asia-Pacific Health Security Action Framework, or APSAF. APSAF is a prime example of states parties' collaboration with WHO, showing how we can integrate lessons learned from the COVID-19 pandemic into constructive and effective regional strategies for future health security. New Zealand thanks the Secretariat for its reporting on WHO's work in health emergencies, including its implementation of Resolution WHA 7511. We're encouraged by the WHO's ongoing investment in preparedness and readiness and commend the WHO for supporting 74 countries to develop national action plans for health security. Turning to the draft decisions under this item, we remain alarmed at the terrible loss of life and the human suffering caused by Russia's illegal and unprovoked invasion of Ukraine and its ongoing war of aggression. This war is a gross violation of international law, and we urge Russia to heed the international community's calls to withdraw its troops and to its internationally agreed borders. We strongly support Ukraine's sovereignty and territorial integrity and the Ukrainian people's right to health. We will continue to work closely with our partners, including the WHO, to support Ukraine. We urge all members to vote in favour of Ukraine's draft decision. New Zealand will not support Russia's draft resolution, which is a cynical text that ignores Russia's own culpability for the alarming health emergency in Ukraine. We encourage others to join us in voting against the text. Chair, the establishment of the Health Emergencies Gender Working Group, which will support the implementation of a gender mainstreaming strategy, is a positive step to address gender-based inequities that arise in health emergencies, and we would welcome further updates on the working group's achievements in due course. Alongside this, we reiterate the importance of sustained efforts to prevent instances of sexual exploitation, abuse and harassment across the WHO's operations, taking into account the value of multi-sectoral collaboration and a survivor-centred approach. New Zealand welcomes the integration of PRSEAH efforts into the WHO's emergency health responses over the last year, including the Ukraine humanitarian crisis and the Uganda Ebola outbreak. Chair, we now turn to the Secretariat's proposals to strengthen the global health architecture for health emergency preparedness, response and resilience. We recognise that some consultation has taken place on these proposals since EB 152. However, it is unfortunate that the time provided to Member States to answer the Secretariat's guiding questions, particularly those around coordination with the diverse range of stakeholders, was not sufficient for Member States to meaningfully engage at national level. We suggest that, given the importance of this work, Member States be given the opportunity to share substantive written feedback on the paper for a 2-week period after this Assembly. In the interim, New Zealand believes this report underscores the need for strong leadership and coherence across our global efforts to improve HEPA. As governors of this organisation, it is up to Member States to reinforce the WHO's clear mandate and ensure that it is adequately and sustainably financed to complete the work we ask it to deliver. As we all know, the landscape for HEPA is a crowded one. Many Member States are struggling to engage comprehensively across the evolving body of initiatives in this space. New Zealand appreciates the WHO's support in ensuring that HEPA work programs remain coherent and avoid duplication. This is particularly important when new leadership or governance mechanisms are concerned. Any new structures must add to the coherence of the system rather than create further fragmentation. At this stage in our 2 parallel negotiations, we believe the Secretariat's role in facilitating the INB and WGIHR processes remains of high importance, ensuring both negotiations are positioned to deliver successful outcomes in 2024. This will reflect a joint investment and a joint commitment by both Member States and the Secretariat in bringing these critical negotiations to fruition. New Zealand looks forward to working with all Member States, all States parties, to identify options and solutions in the months ahead. Thank you.
Thank you, New Zealand. Now the floor to Delegate of Senegal, followed by Delegate of Israel.
Merci, Monsieur le Président.
Thank you.
Le Sénégal voudrait se prononcer sur le point 15.1 et précisément sur le sous-point relatif aux essais cliniques et à la production de données factuelles. Monsieur le Président, le Sénégal félicite le secrétariat pour le travail important fait dans le cadre de l'amélioration des essais cliniques conformes aux principes éthiques et salue la production du rapport y afférent. Le Sénégal magnifie les mesures préconisées par le secrétariat, particulièrement le renforcement de l'appui pour le développement des essais cliniques et l'élaboration de l'outil d'auto-évaluation de leur écosystème. Toutefois, il serait utile de mettre en exergue le travail fait par l'OMS à travers le Forum africain pour la régularisation des vaccins, AVAREF, qui s'investit dans la production de méthodes et d'outils de promotion et de gestion des essais cliniques. En outre, un système de suivi annuel de l'application des outils utilisés pour faire le point avec les pays. Cet état des lieux est partagé chaque année à travers une réunion du comité de pilotage et de l'Assemblée générale du dit forum. S'agissant des mesures prises pour le renforcement des essais cliniques au Sénégal, il a été créé en 2022 l'Agence sénégalaise de réglementation pharmaceutique ARP avec l'activation de la fonction sur les essais cliniques. Au plan législatif, une proposition de loi sur la pharmacie, le médicament, les produits de santé est en cours d'adoption par l'Assemblée nationale. De plus, le Comité national d'éthique pour la recherche en santé, acteur important dans la régulation des essais cliniques, vient d'être certifié en démarche qualité ISO 9001-2015 par Veritas International. Ainsi, le Sénégal prend note du rapport soumis par le secrétariat et s'engage à mettre en œuvre les recommandations afin de contribuer à l'amélioration de la régulation des essais cliniques dans tous les États membres de l'OMS. Je vous remercie de votre bien aimable attention.
Thank you, Delegate of Senegal. Now, Delegate of Israel, followed by Delegate of Poland.
Thank you, Chair. Israel would like to reiterate its full support to WHO's effort in leading the processes to strengthen the way countries and the world prepare for, prevent, detect, and respond to health emergencies. We deem it essential that national, regional, and global efforts are coordinated and coherent, providing an effective framework and tools for member states and the global community. We should ensure that the outcomes of our negotiations are feasible and appropriate to achieve their purpose, a safer future for all. We believe that it's states' responsibility to protect their people's health. However, only through a joint global effort will we be able to enhance the world's capacity to face current and future spread of diseases. We consider the WHO to be the principal body in leading these efforts. The COVID-19 pandemic, as well as other outbreaks in recent years, have highlighted the importance of international cooperation. The processes we have started together are beyond ambitious. Israel wants to avoid duplications and ensure that the INB and the IHR working group work synergetically and in coordination. Israel, together with Morocco, also coordinates the consultative process towards the high-level meeting on pandemic prevention, preparedness, and response that will take place in New York this September. We believe that this work will complement, fuel, and accelerate our work here in Geneva. We would also like to take the opportunity to call for future streamlining. The success of international mechanism is determined by their efficacy. We note our past experience with COVAX, in which our attempts to offer millions of COVID-19 vaccines were not utilized. We must also maintain an appropriate balance between ensuring adequate provisions of emergency tools and medicines during global health crises, while also protecting the rights of providers and suppliers. With lesson learned, we must ensure that we are strengthening the IHR and providing stronger foundations through the INB to improve preparedness, prevention, and response for future pandemics and health crises. Chair, I would like now to address to some of the active emergencies mentioned in the DG's report A7611, and to start by thanking the World Health Organization and its team on the ground for their vital work conducted under extremely challenging circumstances around the world. These emergencies have affected millions. Given their scale, complexity, and inherent operational challenges, they have required the highest level of organization-wide support. By noting the report today, Member States will ensure the continuation of WHO work in providing emergency support in cases like floods, earthquakes, and conflicts, and support states to build sustainable preparedness for health emergencies and expand their capabilities. Chair, Israel reiterates its deepest condolences to the people of Turkey and Syria following the devastating earthquakes earlier this year. Israel supports WHO's response to this emergency, and through Operation Olive Branch also responded resolutely and without delay, sending hundreds of personnel and establishing a field hospital in coordination with WHO and other humanitarian organizations, which treated hundreds of people and saved lives. Israel also expressed serious concerns over a continuing health emergency in Ukraine and refugee-receiving and hosting countries, triggered by the Russian Federation's aggressions against Ukraine. The war continues to inflict devastating impact on Ukraine's health system and has severely restricted access to medicines, facilities, and health services for the Ukrainian population. It continues to be important for WHO and member states to support the Ministry of Health of Ukraine to restore disrupted services, assist displaced health workers, and replace destroyed infrastructure. Israel is working with Ukraine on long-term medical rehabilitation program, focusing on mental health and orthopedic injuries who required prosthetics and rehabilitation. Israel also conducted dozens of capacity building and trainings for health personnel. We will continue to do all that we can to assist the well-being and health of the Ukrainian people. I thank you, Chair.
Thank you. Now, Delegate of Poland, followed by Delegate of Ghana.
Thank you, Madam Chair. Dear colleagues, Poland fully aligns with the statement made on behalf of the EU and its member states on the agenda item 15.2. We would like to thank the WHO for the ongoing assistance provided to all countries in crisis of various types. It's been well over a year since Ukraine faces a full-scale aggressive war started by Russian Federation. Let me reiterate that regardless of narration of Russian authorities, this war is unprovoked, unjustified, and illegal. We condemn Russia's aggression against Ukraine in the strongest possible terms and express full solidarity with Ukraine and its people. We call every country to undertake every possible steps to exert pressure on Russian Federation to end the aggression against its neighbor. The independence of Ukraine has to be respected and its territorial integrity fully restored. The implications of this conflict go far beyond our region. This aggression has started an energy crisis, exacerbated the existing food supply challenges. As every other conflict, this one has huge impact on health, well-being, and efforts to close the existing gaps in socio-economic disparities. The direct health and humanitarian consequences are dear. In more than a year, 14.5 million people are in health need, with no proper access to basic health care services. 8.1 million people have left their country, and many of them still remain abroad. There were almost 22,000 civilian casualties and over 760 verified attacks on healthcare infrastructure. Let me express my great satisfaction that in response to the aggression of Russia against Ukraine, a few days ago, the countries of the Euro region almost unanimously have decided to move the WHO Euro NCD's office from Moscow to Copenhagen at the special session of the Regional Committee. The country which starts an unprovoked war and destroys everything what has to do with health and well-being cannot host an office dedicated to their improvement.
Excuse me, there is a point of order. The legal.
Благодарю вас, госпожа председатель.
Yes, please.
Да, благодарю вас, госпожа председатель. Хотели бы в очередной раз попросить вас призвать страны к порядку. Мы сегодня несколько раз слышали заявления, которые не имеют никакого отношения к мандату Всемирной организации здравоохранения, но вот сейчас это уже перешло просто все рамки. Обсуждать, что, как трактуют страны, агрессия, не агрессия, нарушение, не нарушение, это вот в Нью-Йорк, в Совет Безопасности, на другие площадки. Здесь мы говорим про вопросы здравоохранения и все, что относится к чрезвычайной ситуации в области здравоохранения. Благодарю вас.
I am mindful that some delegations have, in addressing the health situation, made mention of matters peripheral to health. I will exercise the power to call a speaker to order if I feel they are devoting a significant part of their intervention to a subject completely unrelated to health. I would also note that member states have the opportunity to request a right of reply if they wish. Please, Poland, conclude your statement without any additional disregards. Thank you.
Madam Chair, I think that also it would be nice if one delegation would not disturb the other during the statement. Anyway, I was talking about WHO, Euro and CD's office. Okay, I would like to cordially thank the WHO and other health and humanitarian actors for its continuous efforts to alleviate the burden of war in Ukraine. I thank for any assistance led also to the countries neighboring Ukraine, including my own. We encourage the WHO to take further efforts to mitigate the negative health and humanitarian impacts of this war. Let me also reiterate that the Polish government will continue to support Ukraine, its people, its health system, health workforce and patients as long as it needs. And of course, Poland supports the draft decision submitted by Ukraine. Thank you very much.
Thank you, Delegate of Poland. Now, Delegate of Ghana, followed by Delegate of Kazakhstan.
Thank you very much. Ghana thanks you for the opportunity to take the floor to comment on agenda items 14.2, 15.1, and 15.2, and aligns a statement to that delivered by the Republic of Tanzania on behalf of the African region. Ghana commends the WHO for its continuous support and work in emergencies, especially in the African region. We also commend WHO for initiatives like World Health Emergencies Program, Gender Working Group, the Global Arbovirus Initiative, and its continuous work in supporting countries to strengthen One Health Initiative and promote peace and security. Ghana commends the WHO for the initiative towards amending the IHR 2005 and recognizes the effects of COVID-19 pandemics can be used to enhance the new instrument on health security. Core capacities mentioned in the IHR must be strengthened, and the need for adequate and predictable funds for PPR must be emphasized. Again, we note the continuous work in completing the pandemic accord and urge the Secretariat to at all times reflect the issue of equity. In relation to 15.1, we commend the progress made in clinical trials. Without these trials, we will not be able to come out with effective interventions to appropriately address emerging pathogens. Chair, in clinical trials, Ghana has a functional regulatory system and has been designated as a regional center for regulatory excellence for the training of personnel within the African region for clinical trial regulation. We call for support in this area and more stakeholder consultation to promote research. Ghana has also launched a human resource strategy to improve the research capacity of public health workforce and sometimes to undertake national simulation exercises after reviews, training on IDSR case management, laboratory safety, and risk communication. By virtue of the several outbreaks, Ghana sent notifications to the IHR National Focal Point on the following events: COVID-19, measles, mpox, Marburg viral disease, and circulatory viral disease, circulating virus. Ghana continues to strengthen its core capacities by using the IHR monitoring and evaluation framework. Ghana faces the following challenges: inadequate funds for rollout of EIDSR and sustained simulation exercises, minimum capacity for event-based surveillance, and shortage of laboratory reagents. We call for technical and financial support for these. In conclusion, we emphasize that commitment to implementing IHR, but calls for synergies between IHR amendment processes and IMB Pandemic Treaty instrument. We call on support for implementation of IHR and the establishment of monitoring mechanisms for IHR. Thank you very much.
Thank you, Delegate of Ghana. Now, Delegate of Kazakhstan, followed by Delegate of Namibia.
Уважаемый председатель, уважаемые делегаты, Казахстан выражает свою позицию на вопросы 14.2, 15.1, 15.2. Казахстан благодарит секретариат за проделанную работу. Казахстан уделяет приоритетное внимание повышению на готовность к реагированию чрезвычайной ситуации в области общественного здравоохранения. В целях усиления готовности к чрезвычайным ситуациям, дальнейшего совершенствования мер раннего выявления, оперативного реагирования на возникающие угрозы и их профилактику, в стране принят закон о биологической безопасности Республики Казахстан. Принимаются законодательные акты. Эффективная система противодействия биоугрозам в стране реализуется через стратегическое планирование по предотвращению биоугроз, усилению приоритетности научно-исследовательских направлений в области биобезопасности, построению скоординированной межведомственной системы государственного управления и усилению ее профилактической функции, повышению готовности профильных служб к возможным чрезвычайным ситуациям, внедрение единой системы управления биорисками и прогнозирования биоугроз со смещением акцентов с борьбы с последствиями на прогноз и оценку биорисков. Итоговый доклад комитета в целом соответствует видениям Казахстана по вопросам реформирования глобальной архитектуры, обеспечения готовности, реагирования и повышения устойчивости к чрезвычайным ситуациям в области здравоохранения. Наша страна поддерживает разработку нового международного инструмента ВОЗ по предотвращению пандемии, обеспечению готовности к ним и принятию мер реагирования в рамках межправительственного переговорного органа в части расширения партнерских связей и усиления сетевого взаимодействия в целях обеспечения мониторинга и эпиднадзора, защиты населения, медицинской помощи и доступа к медицинским средствам и противодействием болезни. Отмечаем, что вопросы готовности страны к чрезвычайным ситуациям в области здравоохранения, профилактики и реагирования на вспышки регламентируются национальным законодательством и рекомендацией ВОЗ и рассматриваются с точки зрения приемлемости и актуальности для страны, а также возможности их реализации. В связи с этим предлагаем сохранить инструмент ежегодной отчетности государств-участников на основе самооценки и добровольный механизм совместной внешней оценки. Пандемия COVID-19 способствовала усилению автоматизации и цифровизации. В этой связи полагаем актуальным ММСП предусмотреть внесение дополнений в части цифровизации и укрепление региональных и глобальных сетей под эгидой ВОЗ. Казахстан в целом поддерживает развитие международного сотрудничества для предотвращения трансграничного распространения инфекций с условием сохранения принципа суверенитета государств-членов ВОЗ. Благодарю, господин председатель.
Thank you, Delegate of Kazakhstan. Now, Delegate of Namibia, followed by Delegate of Kenya.
Thank you, Chair. Namibia aligns with a statement delivered by Tanzania on behalf of the 47th member states of the WHO Africa region. I shall limit our intervention to agenda items 14.1, 14.2, and 15.1. On agenda item 14.1, we commend the Director General and Secretariat for the ongoing support that WHO is rendering to countries through the Health Emergency Program. We believe that WHO plays a vital role in protecting the health and well-being of all people around the globe. In this regard, we welcome the establishment of the Independent Oversight and Advisory Committee, the IOAC, for the WHO Health Emergency Program. We believe that the IOAC can play a central role in providing independent oversight and advice to the WHO and ensuring that the program is able to respond effectively and efficiently to health emergencies. Namibia supports the IOAC's mandate and welcomes the IOAC's role in conducting periodic reviews of the health as emergency program, including its preparedness, response, and recovery efforts. We believe that such reviews can help identify areas for improvement and provide recommendations for strengthening the program. However, we underscore that this should be done fully adhering to the principles of transparency and accountability. On 14.2, Namibia recognizes the importance of the international health regulations of 2005 in preventing, detecting, and responding to health emergencies of international concern. We believe that the implementation of this regulation is crucial in protecting the health, well-being, economies, and people's livelihoods around the world. We emphasize the importance of building and maintaining core capacities for health emergency preparedness and response as outlined in the IHR of 2005. Such capabilities, in our opinion, are necessary for the effective domestication and enforcement of laws, as well as for the preservation of public health in countries. Namibia urges all member states to continue reporting such public health incidences of global concern in a prompt, transparent, and accurate manner in accordance with the IHR. We also encourage WHO to continue to provide technical support to member states in this regard. On item 15.1, Namibia takes note of the proposal put forward on strengthening the global architecture for health emergency preparedness, response, and recovery. We appreciate the proposals are categorized in three main pillars, guided by the core principles of equity, inclusivity, and coherence. We commend the DG for this helpful approach, as it allows member states to engage more meaningfully in discussions to advance these principles. In order for health systems to have the ability to prevent, timely detect, and adequately respond to all health emergencies, it is pivotal that the operational readiness of the 5 interconnected multi-sectoral HEPR systems are prioritized, and these include collaborative surveillance, community protection, as well as safe and scalable care. Moreover, Namibia underscores that ensuring adequate, predictable, and timely finances for HEPR is essential. In our view, the global health regime for HEPR has been skewed for many decades, resulting in devastating inequity. We have all seen this play out during the COVID-19 pandemic. The pressures exerted on developing countries carry out surveillance and reporting without taking into account their capacities to take on such obligations is an injustice. The current reality is that health products are manufactured in industrial countries using the pathogens and genetic sequence data from developing countries. People from developing countries are used as test subjects in the development of health products. These products are then sold to developing countries at unaffordable prices. And if these countries do not have the money, developed countries provide them with loans to develop under a perpetual burden of debt. This too is an injustice. The injustice and inequities have been going on for far too long. We call on all member states to address these injustices and inequities through the global processes established under the INB and the WGIHR to have a reformed and equitable global health architecture for the benefit of all. In conclusion, Namibia notes the report under the respective agenda items. We reaffirm our commitment to the process of strengthening HEPR and strengthening the global health architecture. I thank you, Chair.
Thank you, Delegate of Namibia. Delegates, I'm going to close the list of speakers at the end of this afternoon session. I will ask the Secretariat to read the list The Secretariat, the floor is yours.
Thank you, Chair. Kenya, Singapore, United Arab Emirates, Slovenia, Uruguay, Timor-Leste, Paraguay, Panama, Malawi, Tonga, Switzerland, Indonesia, Nicaragua, Australia, Cuba, Dominican Republic, Niger, Fiji, Saudi Arabia, Bolivia, Spain, Samoa, Malaysia, Brazil, Burkina Faso, Syrian Arab Republic, Maldives, Democratic Republic of Congo, Tunisia, Russian Federation, Côte d'Ivoire, Bulgaria, Republic of Korea, Algeria, Argentina, Gambia.
Thank you. Delegates, if your country name has not been read out and you still wish to make statement at the evening session, please raise your name plate now. So now the Secretariat will take note of the countries, and we will continue with Kenya, followed by Delegate of Singapore. Kenya, please, the floor is yours. If Kenya is not ready,
yes, thank you,
Singapore.
Chair. This is Kenya.
Kenya, sir.
Thank you, Chair. Kenya aligns this statement with that delivered by the United Republic of Tanzania on behalf of the 47 member states of the Africa region. The statement will be limited to agenda items 14.2 and 15.2. On agenda 14.2, Kenya recognizes the important role of IHR in ensuring that public health threats are promptly detected and notified to the WHO to trigger appropriate response, and Kenya has continued to implement activities geared towards strengthening the IHR core capacities to enable the country to play its part in achieving this goal. Kenya has made commendable achievements towards the implementation of IHR, but notes that the full implementation of the IHR minimum core capacities is limited in Kenya, like other developing countries, by capacity and resource constraints. We therefore call for additional resource mobilization for implementation of the IHR, as well as additional support to member states to build the IHR core capacities for full implementation of the regulations. On the IHR amendment process, Kenya takes note of the progress made and agrees that this process will improve the future implementation of and compliance with the regulations. Kenya sits on the Bureau of the WGIHR and assures of her continued leadership and constructive engagement in the working group on IHR amendments. Kenya also notes the progress and will continue to support the work of the Intergovernmental Negotiating Body on the WHOCA+, and looks forward to enhanced coordination and promotion of a mutually reinforcing relationship between the INB, the WGIHR processes, and other processes aimed at strengthening pandemic prevention, prepared and response as outlined in the HEPR. Kenya further reiterates that equity in access to essential commodities, services, tools, and financing must be captured as fundamental principle and outcome of these processes. On Agenda 15.1 on strengthening WHO preparedness for and response to health emergencies, Kenya notes that the health emergency preparedness and response capacity of health systems is critical to achieving global health security as a key lesson learned from the COVID-19. Regarding building of resilient health systems in countries, including efforts to prevent, promptly detect and respond to public health emergency threats, including through establishing capacities for local and regional manufacturing of pandemic-related medical commodities. Chair, Kenya supports the adoption of the report and recommendations as submitted by the Working Group on the HEPR, highlighting the need for equity, inclusivity, and coherence of systems, governance, and financing for HEPR, as well as integrating primary healthcare, health promotion, and health security through the One Health approach. Additionally, Kenya is implementing the global and regional strategies to improve prevention, preparedness and response to health emergencies through a national action plan for health security using a One Health approach. Chair, Kenya has also developed a 2-year roadmap for the Regional Emergency Preparedness and Response flagship initiative for Africa to improve efficiency, effectiveness, and resilience of health systems to promptly detect, prevent, and respond to public health emergencies. To build surge capacity, a cohort of multi-sectoral African volunteer corps for strengthening and utilizing response groups for emergencies, AVOC surge members, have been trained and can be deployed for public health emergency response within the country, as well as to support response at the regional and global level. Kenya notes the report on the HEPR commends WHO for its work with member states on the initiatives therein, and calls for additional resource mobilization for scale-up and full implementation of these initiatives, particularly at national level. Regarding strengthening of clinical trials, to provide high-quality evidence on health interventions and improve research quality and coordination, Kenya notes the report and commends the Secretariat's effort to establish the baseline of existing clinical trials ecosystem. To strengthen these systems for implementation and coordination of clinical trials at the country level, Kenya has taken a bold step and has established a robust clinical trials regulatory framework under its national regulatory authority, the Pharmacy and Poisons Board. However, additional funding and technical support will be required to support the functioning of this role effectively, including from WHO. I thank you.
Thank you, Delegate of Kenya. Before going to Singapore, followed by United Arab Emirates, I would like to request the Secretariat to please read out the name of added member state to the list. Thank you.
Thank you, Chair. The previous list stopped at Gambia, and we have added Botswana, Angola, Haiti, and Belarus.
Is there any other member states that wasn't read? Please raise the nameplate. So we will consider the list as complete for the evening session. And going now back to Delegate of Singapore, followed by Delegate of United Arab Emirates.
Thank you, Madam Chair. Singapore's intervention relates to agenda items 14.2 and 15.1. Singapore affirms WHO's work in strengthening the global health architecture and coming up with the 10 proposals. Implementation of the international health regulations to ensure state parties fulfill core capacity requirements to prevent, protect against, and respond to pandemics is of critical importance to strengthen the global health architecture, since it is directly linked to the risk of the international spread of diseases. We would like to offer a few points. First, there is value in adopting a regional approach to strengthen core systems to prevent, detect, and respond effectively to health emergencies in some situations. A regional approach can provide the scale needed for certain initiatives that individual countries lack, but also enable a response speed that is challenging for global systems. For example, in strengthening the vaccine manufacturing ecosystem and in enhancing surveillance systems. Singapore has been tapping on existing regional structures, such as the Association of Southeast Asian Nations, or ASEAN, to develop a multi-country proposal on an ASEAN genomic surveillance network, which we have submitted to the Pandemic Fund in their first call for proposals. Enhancing collaboration will strengthen the health security of the region by uplifting countries' surveillance capabilities against emerging and future public health threats. Second, robust public health emergency preparedness and response architecture and resilient health systems are built on a strong primary healthcare base. We have learned through the pandemic that primary care providers play critical roles, for example, in the right siting of care and provision of surveillance data. In Singapore, it has also increased visibility of the primary care sector and catalyzed its enhancements through its significant role in our national strategy called Healthier SG for Singapore, in which Singapore is moving away from sick care to preventive care. Third, the pandemic has shown that there is a need for member states to systematically build up strong public health expertise and organizational capability and capacity. This could be supported by the Secretariat through the sharing of knowledge provided from the WHO's various technical panels. Singapore is in the midst of merging its communicable disease-related public health functions, as recommended by our post-COVID-19 parliamentary white paper, into a single, comprehensive entity to enhance our readiness and preparedness for future health threats. By consolidating Singapore's public health functions, we aim to improve overall command, control, and coordination of public health responses in any future public health emergency. Thank you very much.
Thank you. Now, Delegate of United Arab Emirates, followed by Delegate of Slovenia.
Thank you, Chair. We would like to thank WHO Secretariat for preparing such a comprehensive report on the 1 billion more people better protected from health emergencies. In line with the preparednesses and response to the public health emergencies, the United Arab Emirates is deploying all efforts and commitments to ensure the implementation of the International Health Regulation 2005. And we extend our heartfelt appreciation to the Director General and the Working Group on Amendments to International Health Regulations and its Bureau for their extensive discussions and consultations in relation to the proposed amendments. UAE priority for finalizing IHR amendments and avoid overlaps in scope, roles, interventions with the pandemic treaty. Furthermore, UAE stressed the importance of equity, information technology, and governance to be prepared for any future pandemic. Regarding the Global Health for Peace initiative, the United Arab Emirates is committed to implementing the provisions of the International Health Regulations, which states to provide support and assistance between the party states by providing the required logistical support in the events affecting public health, or technical support, mobilizing financial resources, and ensuring cooperation and coordination of the agreements concluded. We also urge the General Secretariat to continue consulting all actors and to study all aspects related to the initiative, including the pros and cons of the initiative on humanitarian health work. Thank you.
Thank you. Now the floor for Slovenia, followed by Uruguay.
Thank you, Chair. Honourable delegates, Slovenia aligns itself with the statement delivered by Sweden on behalf of the European Union and its member states, and would like to make further remarks in relation to the agenda item 15.3, Global Health for Peace Initiative. The interconnectedness between health and peace cannot be overstated, with each serving as a pillar for the other's stability. As representatives dedicated to the welfare of nations, we must acknowledge the critical significance of prioritizing global health as a foundation for peace. Robust and inclusive healthcare systems based on principles of solidarity foster social cohesion, reduce inequalities, and address the underlying causes of instability. By addressing key social determinants of health, such as poverty, education, and gender equity, we establish an environment conducive to peaceful coexistence, effectively mitigating the risk of tensions escalating into violence. Furthermore, effective global health interventions enhance resilience and stability in communities, countries, and regions. We have witnessed how outbreaks of infectious diseases, natural disasters, and other health emergencies can disrupt societies and ignite conflicts. By fortifying health systems, establishing vigilant surveillance mechanisms, and bolstering response capacities, we can mitigate the impact of such crises, bolster stability, and sustain peace. Moreover, collaboration, cooperation, and solidarity in global health serve as potent instruments for diplomacy and trust building among nations. We embark on joint efforts to combat shared health challenges. We transcend political and ideological divisions. Common goals encompassing disease eradication, immunization campaigns, and health research foster dialogue, forge connections, and create avenues for peaceful interactions. Engaging in global health partnerships cultivates goodwill, enabling nations to work together towards sustainable peace. And let us not forget that the health workforce is bound to ensure treatment for all that need it, regardless of gender, religion, nationality, age, or occupation. In the light of these considerations, we must emphasize the importance of supporting the Roadmap for Global Health for Peace initiative, and we thank Switzerland and Oman for starting this initiative in the first place. Thank you.
Thank you, Delegate of Slovenia. Now, Delegate of Uruguay, and followed by Timor-Leste.
Gracias, señora presidenta. En relación al punto 14.1, tomamos nota de las múltiples emergencias sanitarias durante el periodo comprendido en el informe y de las recomendaciones del Comité Independiente. Sobre este punto, quisiera hacer referencia a la solicitud del Comité de dotar de personal y recursos al programa de emergencias sanitarias, y queremos destacar que nuestro organismo regional, la OPS, enfrenta similares dificultades y necesidades. Creemos que es fundamental reforzar las capacidades regionales para responder a las emergencias sanitarias. En cuanto al punto 14.2, la pregunta de cómo pueden los Estados miembros de la OMS seguir reforzando la aplicación del RCI en los próximos años, teniendo presente que seguirán examinando las propuestas debidas al RCI y no entrarán en vigor al menos hasta el 2025, creemos que reforzar las capacidades regionales y locales es la respuesta, mediante la capacitación de recursos humanos y el apoyo a los gobiernos para que desarrollen y fortalezcan sus capacidades de respuesta, buscando soluciones dentro del ámbito de la colaboración regional. Sobre la pregunta de cómo puede la Secretaría apoyar mejor a los Estados miembros, organizaciones internacionales y otras partes interesadas pertinentes en el esfuerzo de aplicación del RCI, muchas propuestas para las enmiendas apuntan a un escenario donde los niveles centrales de la OMS estarían más burocratizados. Creemos que los esfuerzos y recursos deben volcarse a nivel de las distintas regiones, que es necesario descentralizar y es imprescindible trabajar en cercanía con los Estados miembros y sus diferentes realidades. Sobre el punto 15.1, fortalecimiento de la arquitectura mundial para la preparación, respuesta y resiliencia frente a emergencias sanitarias, en el documento A76/10 coincidimos con la importancia de fortalecer la arquitectura mundial para emergencias sanitarias, y para esto es necesario mejorar la gobernanza del sistema. Quisiera destacar la dificultad de tener una activa participación para algunas delegaciones, en particular para las más pequeñas, en esta importante iniciativa y además de los otros procesos y negociaciones que están teniendo lugar. sobre fortalecimiento de los ensayos clínicos luego de la resolución adoptada en la anterior asamblea y la consulta pública, hemos estado trabajando en fortalecer nuestro sistema nacional de investigación con el apoyo de la OPS. Sin embargo, es necesario mejorar la calidad y transparencia de la investigación y crear una herramienta de autoevaluación con indicadores de madurez del ecosistema de ensayos clínicos. Respecto al punto 15.2 sobre la labor de la OMS en emergencias sanitarias, quisiera destacar que la COVID-19 y el brote de viruela símica son las únicas emergencias sanitarias de la región de las Américas a las que hace referencia el informe. Sin embargo, en el periodo objeto de informe se han declarado 2 emergencias, entre ellas poliovirus, brote de cólera y otras sin clasificar, además de las crisis de seguridad. Sobre el punto 15.3, Iniciativa Mundial para la Paz, Uruguay entiende que el ámbito de la paz y la seguridad está ligado al concepto de seguridad humana. Por ese motivo, resulta imprescindible que la dimensión sanitaria se tenga en cuenta en estrategias que tengan como finalidad la paz. Mi país hace hincapié en la prevención de los conflictos y, por consiguiente, entiende que el componente de la salud y de una infraestructura y acceso básicos a la salud resultan fundamentales para prevenir determinadas situaciones de fragilidad social que puedan conducir a conflictos. De igual modo, si se consideran todas las etapas de mantenimiento, establecimiento y consolidación de la paz, en todas ellas la salud de la población resulta fundamental. Sin salud no puede implementarse exitosamente ninguna de ellas. Por otra parte, nuestro país se encuentra firmemente comprometido con la agenda de mujer, paz y seguridad y presta especial atención al impacto desproporcionado que los conflictos tienen sobre las mujeres, niños y niñas. En esta línea se deben considerar las particularidades que afectan a las mujeres a nivel sanitario. Finalmente, Uruguay valora este tipo de iniciativas transversales que toman en cuenta los esfuerzos de las distintas agencias del sistema para tener impactos duraderos en varias dimensiones, dado que un conflicto está vinculado a más de un solo factor y responde a más de una problemática. Asimismo, comparte el principio de trabajo mancomunado con los Estados miembros para lograr los más altos niveles de salud en cada población, así como la aprobación y el liderazgo locales de la hoja de ruta, ya que los actores nacionales y locales se dedican al servicio de la salud, conocen mejor que nadie lo que es factible en cada contexto. Muchas gracias.
Thank you, Delegate of Uruguay. Apologies for Delegate of Timor-Leste because we have been informed that the interpreter will not be available. So we will close this session and you will be the first country to read their statement on the evening session. Delegates, we have now come to the end of our meeting, so we will suspend our discussion. Before we break, I would like to remind delegates that Committee A will hold its 5th meeting this evening from 8 p.m. to 11 p.m. When we resume, we will continue our discussion on the grouping of sub-agenda items 14.1, 14.2, 15.1, 15.2 and 15.3. I would also like to inform participants attending the evening session that sandwiches will be provided in front of Silla 20 at 7:40 p.m. The meeting is adjourned. Thank you.
Well done.
I'm sorry.
Well done.
If I come late, you will start.